Hello, everyone. So this is Anastasia. So I think a big chunk of everyone attending today knows me, and whoever doesn't, I'm a product manager. I'm the product manager of Oryx Dental Software. I've been with the software for 5 years, and I'll be going with you through today's training. So what we're going to be doing, or what we're planning for the coming couple of days, is going to be first day is our full in-depth lecture. So it will go over Oryx, how it ties all together, what makes it work, what the flows are, and why are things basically done the way they are in Oryx, and hopefully giving you all the tools for you to best utilize the software. And I think there's a lot of things that have been added over time, and we've been constantly developing so many features, and I think a lot of people might be unaware of some small things that have been released over time, or even some big features. And I think it would be a great opportunity for everyone to learn what the software is all about, and what's already out, what's coming out soon, hopefully as well. And that will give everyone a great way to learn the software and to learn how to actually implement it in their own practices. Our attendees are a great number of people, and we're ranging from some expert users that have been with us for years now, and we love all our users, and they've been such amazing support, and they've been such amazing source of feedback over the years. And we have people that are just transferring over to Oryx, so some people are going to be seeing a lot of those things for the first time. And we have even some attendees right now that are considering Oryx as a practice management software for their own practice. So I think that will be a great as well opportunity for them to see it as a full flow from start to end. So we're going to have different levels of knowledge of the software, and I'm going to try my best to make it interesting and make it beneficial for everyone, so that every single person can take something out of this at the end of the day. So today we're gonna do the tying it all together section. Tomorrow, Wednesday, is gonna start again at 8 a.m. and Nika is going to be doing the flows. So she's going to show you how to use Oryx in your own office. So it will show you how a patient flow works in Oryx for a new patient, for a hygiene recurring visit, and for a treatment visit. So she'll go over the entire software as a flow, so you can see how it's implemented, how different parts of the team or how different team members will be using the software, which pages might be like the home base of every team member. So it will be a great opportunity to see the software in practice and actually in use under different circumstances, different cases. So we'll be covering a lot of in-depth as well, special kind of scenarios under the second day. At the end of the day, on Wednesday, we'll be sending out advanced exercises for everyone, and we'll be giving you access to the test account, so you can actually hopefully implement the full exercise of a patient in the software with no problems. So that will be your kind of homework on Wednesday. And then on Thursday, what we're going to do is we're going to actually show you or walk you through the exercises. So we'll show you how it's done, the easiest way to do it, to show you how maybe there are different shortcuts that you can do things that you might have basically missed. So it will hopefully be a full-on walk through the exercises, so you can actually learn if there are any things that were done out of order, if there are things that you weren't able to figure out. That will be our third day, obviously, and it will actually have a Q&A session at the end. So this is how our training is structured for the coming 3 days. A couple of things just before we start. First of all, I think you guys all noticed that everyone is muted, so that way we don't get questions in the middle of the presentation. However, every single section of the presentation, I will stop. We'll have a break for 10-15 minutes. And you probably noticed that on your screens you have a Q&A section on Zoom. And this is where we will be actually reading and answering your questions. So please make sure that you don't send your questions through the chat box, but actually use the Q&A, because we have our support agents sitting actually and reading all the Q&A questions coming in. So please make sure to utilize that. So that way we can actually make sure that we answer all of them. As a small request, please make sure that you don't start asking questions before we get to a particular section, just so that we don't end up jamming our support with too many questions that we're going to be covering anyway at a later point. So for example, if we're covering the patient communication and we didn't get to maybe yet the actual maybe clinical section, let's keep the clinical questions for the clinical section, so that way I'm sure we're going to answer most of those questions before we even have to ask them. And then if anything is not answered, then please make sure that you send it to the Q&A. We will be answering the questions during the breaks or during the basically between the sections. So that way, once we're done with a section, we're taking a break, then our support will be sending out the responses to all the questions being submitted. So that hopefully covers all the technical part of this, so we can actually start with the lecture. As I started off, so our software is going to be, or today's lecture is going to be about the software. And I'm going to start off with the very beginning, what it all started from, and basically what it is now. So hopefully it will make sense as a full software, as a full experience for both the office and the patient at the end of the day. So this entire software was started actually with Dr. Rania. Dr. Rania Salih is our president and CEO. She was actually, she had her own practice in DC, and she graduated from the Kois Center, and she realized that she had a few problems actually when it came to implementing what she learned in the Kois Center. And a lot of things were just simply down to inconsistency and disruptive workflows. So some of the problems that she found once she actually started asking her team members, and when she started actually trying to implement more systems in the office, were actually first and foremost was actually inconsistent data collection. And the problem was that some patients would actually end up with x-rays, others won't. Some people would end up with intraoral photos, others won't. So you end up with basically patient cases that are not consistent. And when it comes to maybe checking on a case after a while, if you want to do a follow-up, you open up that patient case and you realize that there are pieces that are missing here and there. And it's just because of the inconsistency in the way data was collected. So there's no system set for this. So it depends on how much time sometimes we have. It depends on the patient. So it really differs from one patient to another, from one case to another. You end up with the data on every patient not being consistent. And it's really hard to review cases when you actually end up finding out that you're missing a PA here or an X-ray there or a pano there. So that was one of the main inconsistencies that were found in the office. The second problem was actually treatment planning, and there was inconsistency in treatment planning. So, and it especially is clear when you have associates in the practice, and when you have one associate that treatment plans differently from the other, and that could be just simply because of different schools, different trainings that they got. It could be different patients, and different patients might lead you or sway you to different treatment plans. And it became inconsistent due to so many different factors that you end up with the same exact diagnosis, but with actually different treatment plans on every patient. And that became obviously another problem that you want to be able to actually control, especially when you're considering either expanding or already having partners or associates in the office and trying to keep the consistency of the practice basically and the quality of the practice basically maintained. Due to obviously the treatment planning differences and due to other factors, the treatment plan acceptance rate became as well very fluctuating. So some patients accept treatments, others don't, and it sometimes depends on the way you present it to the patient. Sometimes it's about the way you maybe use some specific terms. Some patients are more scared than others, maybe from particular types of treatment. So you don't have a kind of a set way of presenting a treatment plan. So that created basically an acceptance rate that would fluctuate based on who's presenting it, how the patient accepts it, even sometimes the patient mood. So it really varies from one day to another and one from case to another. And that really became completely inconsistent and it was really hard to track throughout the office. And due to basically all of this, there has been a huge clinical difference between, or an outcome between, the different providers. So some providers had more acceptance rates, other providers had more treatment planning options that were maybe more advanced. So some maybe were treatment planning more major restorations versus basic restorations. And that basically means that your clinical outcome is ending up being very different. Sometimes protocols vary from one provider to another. So there must have been a system to actually unify and maintain this kind of consistency in the office. Moving from the clinical team to the front, the whole team realized that there's a lot of disruptive workflow and double entry, because a lot of the softwares are actually, all the softwares on the market are built to be around basically the business side of the office and not really around the patient or the clinical side. At the end of the day, everyone has a dental office that wants to actually provide the best patient care out there. And it's not about only just running the business well numbers wise, but it's actually about as well giving the patient the best care. And that's why Oryx was built around the clinical side, the patient side of it, the patient care, and then everything else comes in together to tie in the entire office in there. So there's a lot of workflows that actually are created in Oryx to simplify and to unify and to minimize double data entry for the team, especially between the back and the front. So routing slips, a lot of the re-entry of treatment plans to send to pre-auths. These are things that a lot of the older softwares have both the clinical and the front to basically be able to manage what should be a very simple, really click of a button. And then a lot of other problems came down to being able to maintain the quality of the office and not having enough tools to assess and maintain that quality is not only looking at the business side of it, but as well looking at the clinical side. So how many patients are getting basically adjustments after maybe their procedures? How many patients are coming in to do redos? These are all major tellers and major flags for the office to keep an eye out on. And a lot of the softwares out there don't actually track those things. And that's where Oryx basically was born from. It was born to actually be able to create systems, to create consistency, and to create a system to actually be able to not only input data correctly, it's to as well analyze it and be able to maintain the quality of the patient care as the main focus of an office. So starting from here, we're going to go into actually Oryx. So Oryx was built into three main platforms or three main modules. So the first one is the patient online portal, which a lot of you already know, which is going to be, or which is MyChart. So it's the patient online forms, and it's the online forms that the patient fills out at home, which we'll go over together. It's the patient communication with the office portal. So that's where the patient will be receiving their online statements. They can do online payments. There's a lot of back and forth, and as well, they will be receiving some of your reports. So there's back and forth communication with the patient through the encrypted online portal for the patient. The second main module of the platform is going to be the clinical management, so which goes over obviously the exam, the treatment planning, the progress notes, your clinical notes, everything related to the clinical module will be in that platform. And then obviously last but not least is the administrative module, which obviously will have the invoices, insurance, the batch statements, online statements, online payments, reporting, dashboards, all of that will go into the administrative module as well. So we'll be covering all three modules together. We'll be covering all the new features as well added to those different modules over time. And hopefully we'll cover any questions that there are related to those modules as we go through. So I'm going to start with the online forms. So the patient online portal, which starts with the online forms. Again, the nice thing about this is that the patient gets a link to your basically forms. So this will contain the medical dental history questions. It will contain their confidential information. And that way the patient can do it from the comfort of their own homes. So They can do it at home on their laptops, they can do it on their phone, they can do it on a tablet, they can do it on any basically device that they have, and they can do it anywhere. They can do it in stages. They don't have to do it all in one go. And that's one thing that is really nice, that patients can take their time. They can do it over maybe a couple of days. If they're home doing some work and they want to take a break, they fill in a couple of sections out of the forms. They don't have to do it all in one go. It automatically saves for them, and they can just continue the moment that they have a moment, and they can actually go ahead and fill out the forms. And once they're done, they submit them electronically and you get notified. So the patient can do it on any device and at any format basically, or any length or duration that they need. So starting off, first and foremost, is the dental history. The dental history starts with what our patients and offices have dubbed as the wheel. So the wheel is going to be this circular form that will be divided into 4 main modules, or 4 main categories, which covers the gum, the teeth health, the bite and jaw, and then the smile. So when you see this has basically every single dental history will be divided into those 4 main categories. Those 4 categories will contain a risk associated to them every time the patient finishes that section. So every category contains a list of questions that are pertaining to this particular category. Once they're done with those questions, then there's a score associated to it, and I'll cover that in a second. So one of the main things that we've actually worked on when we first started with the online portal was actually trying to translate those questions to something that the patient can fill out easily and as well more accurately. And we started off actually, when we first started with this platform many years ago, it started off as a very straightforward question with yes and no buttons, and we realized that a lot of the patients were finding difficulty in filling those forms out for 2 main reasons, really. The first reason was actually they were seeing those questions right stacked under each other. They were getting scared and worried that it's going to take them forever. It was a daunting experience for them, and they were just not willing to go through that. And that was the first main problem that we were bumping into. And the second problem was that a lot of the answers were not accurate. A lot of the answers were being answered haphazardly just because the patient does not understand what is being talked about. So what we did is, after a bit of back and forth, a lot of trial and error, we went ahead with basically a picture-based questionnaire. So what you can see right now on my screen is an example of a question that asks if the patient has period disease. A lot of patients might not imagine even what a period disease looks like actually on a patient or on a person. So the idea is to show the patient what a healthy gum looks like versus what a period disease might look like. And that way the patients can have a reference to what you're talking about or what the question is asking. And then at the same time as well, the patient don't feel that daunting task of having to go through 40, 50 questions, because they're not actually seeing them, first of all. And second of all, they're visual, so it's much easier to go through. Patients actually don't notice how many questions are passing through as they're answering. And some even questions are videos, as you can see here, like the clenching, for example, the space between the teeth. There are some graphics that are static, so they're not really moving, and there are other graphics that actually are visually like more even engaging, with videos, short animations of what the question actually is talking about. So that way the patient either says yes or no, and they at least are answering with a bit more knowledge about what you actually are asking about. So patients start answering questions without realizing the number of questions that they actually answered. So it started going through very smoothly, and offices have let us know that their answers have been much more accurate and much more explanatory, especially that when a patient says yes to any of the questions, the system automatically pops up an extra field for the notes. So that way the patient actually is encouraged to give more information about their condition if they would like to give a bit more, maybe background stories about why or when it happened. So that way, when you're actually importing all this information, you actually have a lot of the background story with it as well. So that way you have all that information on hand even before the patient comes into the office. So at the end of the presentation, at the end of the forms, every single one of those 4 categories that we saw at the beginning will have a score associated to it. So it ranges from low risk, which is the green, the yellow would be the moderate risk, and then you have the high risk, which is in red. So those colors are associated based on not only the number of questions the patient said yes to, but as well the kind of which questions the patient actually said yes to. So they're all based on Dr. Kois's research, on a lot of evidence that we've basically coded in, and we've worked on a scoring system that will not only just count the number of questions, but as well it will be able to tell apart more risky or more high risk questions from other questions. In addition to that as well, you have questions that the system asks for more details. More details are always optional, but for example, if a patient says yes to missing teeth, the system asks how many missing teeth you have and for what reasons. So that way, obviously, there's a huge difference between having wisdom teeth missing versus having 5 or 6 teeth missing due to perio disease. So that way, not only do you know that they're missing teeth, but you as well have already a good idea of why he has missing teeth, and why what might be something else that would be a high risk for you to look at when the patient comes into the office. So after the dental history is filled out, you move into the medical history. And the medical history was another actually challenge for us to overcome, because a lot of patients, when they fill in the forms, they kind of understand why they're filling in the dental forms, but once they go into the medical questions and they realize how many medical questions there are, they actually get really scared. And again, one of those moments when they're like, okay, this is too much, I'm not going to do it. So one of the challenges for us was to actually create another way to simplify the flow for a patient when it comes to the medical questions. And what we did was actually we created categories as well. As you go through the medical questions, it groups together questions that are related. For example, the one that you see on the screen right now is the cardiovascular questions. And it groups all the questions related to the cardiovascular issues in one basically package, and the patient can simply click on the no button and it automatically answers all the 15 questions with a no. So that way the patient doesn't have to actually read and answer every single one of them separately. So for a healthy young patient, he knows or she knows they don't have any problems, then definitely just a no is enough to skip to the next section. Versus if someone actually has problems, as you can see in the screenshot on the right side here, if a patient says yes to high or low blood pressure, the system automatically expands extra sections for the patient to answer. And it actually obviously makes a huge difference for the office to know whether a patient has a high blood pressure or low blood pressure. Is it controlled? Is it not? So that way you can actually tell if the patient needs pre-meds, if you need to be prepared for anything. You actually have all this information on hand before the patient actually comes in. And this is really important as well for you. And we'll see that in a second when we get to the interpretation key. So the medical history, not only does it have the groups on the right side, but as well it has a simple basically graphic for the patient to see an overview of their medical health. So that anatomy person on the left side will highlight the sections the patient is healthy in, and then it highlights the parts that the patient has said yes to basically are problematic. So that way at the end of the medical history, he'll have an overview of which sections that are actually problematic, that are actually showing up in red on that anatomy person. So it creates kind of a nice overview of the medical questions, but without actually giving him a risk or giving her a risk about their medical status. So the medical and dental history are tools, or it's enough information for you to import, and you have a very good idea about the patient that's actually going to come into your office. So that way, when you actually import this information, you are not only just have forms pre-filled, but you have a very good idea of who's walking through your door, what kind of patient he is. Is he going to be a complex case? Is going to be an easier case? What are the risks? What are the problems that the patient might have? You have a very good idea. So when you import that medical and dental history into Oryx, and that's what you will see on your side, it will contain the interpretation key of every single one of those questions. So both medical and dental history, every single question has an interpretation key on the right side, as you can see basically in here. It will show you the explanation of every single one of the questions. Why is it important? How is it related, especially for the medical questions? How is it related to the patient's dental health? Why is it important to look at this? What other things that might be related to the specific issue? And this is a great tool for every single office. We've had some amazing feedback from offices about the interpretation key, because it really plays a huge role in the education of the entire team, and as well a very nice educational tool as well to explain to patients. The interpretation key is not available for the patients to read. It is too harsh, I guess, with terminology when it comes to the medical and dental terminology used. It is pure evidence, pure literature. So it's really made for someone who has a good basically background. So, but this is a great tool for the entire team, the entire staff to actually read, and it creates a very nice some kind of educational basically tool for the entire team to be on the same page. And we've had a lot of offices that told us that patients came in and they asked, like, why did you ask me, for example, if I have, I don't know, if I have gastric reflux? So why does it matter if I have diabetes? And that way, what the system allows you to do is just simply to open that medical history, and you can read the interpretation key on that right side. And that way you don't have to worry about you don't have to worry about coming up with an answer on the spot, especially for cases, or especially for patient symptoms or problems that you might not be bumping into on a daily basis. So, for example, if patients come in with something that maybe you haven't seen in a long time, instead of you going flipping through your folders trying to find that interpretation key from Dr. Kois's classes, or trying to quickly remember how is it even related to the dental health, that creates a very nice tool that is available for you on the spot, and to explain to you exactly why or how this is related to the patient's basically medical or dental status. So it's a nice tool to as well read for the entire team, because it creates a very consistent terminology or use of terminology in the office. So, and it happens very often that patients ask questions, sometimes to the front desk, sometimes they're just walking up to the operator and they ask the assistant a random question, and sometimes they ask the doctor a question. So patients ask random team members questions about those things. And what this really allows you to do is just for everyone to be on the same page using the same terminology. So it doesn't really matter who's answering the patient. It doesn't matter who is basically explaining to the patient the importance of this medical and dental history forms, because everyone has the same terminology, everyone has access to the same information. So that way everyone is using the same exact way or terms, or basically style of explanation. So that way the patient will have a great respect and as well trust in the words that they're hearing from every single one of the team members, and they won't have to worry about re-asking the same questions to every single other person in the office. So it's really a nice educational tool, again, for the team and for the patient as well, to explain to them the importance of all those questions that are being asked in the medical and dental history. Obviously, in addition to your interpretation key, you do have as well the risk that gets associated with every one of the categories, as we said, and that as well will get imported into your Oryx system. So that way, when you're actually going through the system, and we'll see how this follows you throughout the entire clinical and scheduling module, and you'll see how this helps you better prepare for your patients and how to be able to foresee what kind of cases are coming up for you. So again, that's one of the main things that you'll see as we go through this presentation, as we go through Oryx. the risk assessment of the patient is one of the key factors that will be affecting or that will be contributing towards your clinical module. It will be part of the scheduling module as well, and it will actually play a very nice role with helping you decide how to manage or how to deal with every one of those cases as they come up. So other than, again, we covered that the patient has access to the medical dental history questions. They have access to the confidential questions, the confidential form, which again is the patient's address, contact, emergency number. All of that is covered in a separate section as well online. And then one of the nice things as well that this My Chart allows you to do is online scheduling. And that's a feature that allows you to set up your own schedule for patients to select the times that work best for them. So you can say, I want a patient to schedule only with, let's say, my senior doctor, or maybe with one of the assistants or one of the hygienists. You can open up specific columns. You can add reasons to why the patient is coming in, and they can book their own appointment online, and that way they don't have to call you and schedule that first appointment on the schedule. So again, as you can see, the patient just clicks on schedule appointment. It opens up all the availabilities that you open. So it's up to you to open up as many slots as you want, as often as you want them to be. The patient fills out the basic information like their name, their phone number, and so on and so forth. Obviously, in addition to the medical and dental history questions that get imported as soon as you basically accept and you actually take that patient in and you import them into your system. So that way the patient already scheduled their appointment, they filled in their medical dental history questions, so there's not much that you need to actually worry about anymore other than just on your account. You'll just accept or confirm that appointment, and it will actually add that patient to your schedule, automatically syncs with your schedule, so you don't have to worry about that. And the patient basically just on their own time, they could do it at night, they can do it after working hours, they can do it at any point during their day or night. So that way they don't even have to worry about calling you. You don't have to worry about mailing them their forms. You don't have to worry about adding that patient in on your accounts, because the moment that you confirm and you import that patient, it adds them into your system. It adds their contact information, their medical dental history, everything is in there, and you don't have to do anything about it at all other than just simply importing that patient with their online schedule. Obviously, you will get notified as the admin. Whoever is set up as an admin on the system will get notified with new forms. They'll get notified with new appointments by email. And as well, obviously, once you log into your Oryx account in the morning, you'll have notifications as well waiting for you on the schedule to let you know who has scheduled online and who's waiting basically to be imported into your system. So speaking of importing patients, there are different ways on how to do it, and each one of those ways has their own, I guess, flow, and it depends on your patients. So I'm going to go over the most ideal case, which is a new patient calls you and they decide to actually do their forms at home. So filling in the forms at home is going to be obviously the most beneficial for the office, and as well, it's always great for the patient themselves as well. So two ways to have those links sent out to patients. So the first link is actually the one at the very bottom, which is the send welcome email. And it is a button that's on basically your schedules, which again, everyone that uses Oryx already knows that button. So you just click on the send welcome email, and that person receives an email that says, welcome to our practice, blah, blah, blah. Please fill in the forms. We'd like to know you a bit better. Click here to start. So it takes them through to My Chart. They set up their password. And once they're done, you get notified that the patient is ready to be imported. So this flow here is the most ideal one. The patient fills that out on their own time. Again, they can take as much time as they want, as long as you just basically always tell the patient that please make sure that you're done before your appointment. The second option is redirecting them to the link, and that usually happens in two ways. Some offices really like to have it on their website, and that's something that is very easily done. You just, on your office website, you'll have a button that says new patient forms, or click here to start your forms. whatever verbiage that you would like to use, and it will be a button that you can just embed that link onto your website. And once the patient clicks on that button, it takes them to My Chart. And there the patient obviously goes through the My Chart flow that we talked about. And once they're done, again, you would import the patient. Obviously, especially when you first start with Oryx, it might not be that easy to get patients to fill out their forms. However, it really is all about the way you verb things and the way you explain it to patients and the way you prepare a patient to that. And most of the times, and that's something that you will see as you get more patients to fill out the forms, it's the way you say it to a patient. So instead of making it sound like it's a favor for you as an office, it should more sound like it's actually a favor for them. And so one of the main things, or one of the best ways that we have some offices verbing this, is that basically my doctor would like to know you better, or my doctor would like to be prepared for you, and we would like to know you better. And the more we know about you, the better the patient care is, the more we know how to be ready for you, in whichever way you want to word it. But it really makes a big difference when the patient understands that these forms are not just a hassle that the office is actually forcing the patient to do just because. It's really about utilizing that information to give them the best patient care out there. And when the patient understands this, and when they understand that this is very important to them, and it actually will affect the way their entire experience in the office is going to go, then it really makes a huge difference. And patients usually never say no to good patient care. They'll never say, no, I don't care if you know me. So it really is a big part of this, is really getting patients to understand the importance of this. And the other actually really big part is just telling the patients that this is not really optional, like obviously sounding nice, but telling patients that this is not something that is an optional thing, especially for newer patients, especially for offices that are converting over to Oryx. This is part of your flow. This is part of your protocol as an office. Every new patient has to have their forms digitally filled out online. So not only do you have a digital copy of it, but as well, the doctor would like to read about you before you actually come into the office. So he would be prepared for you. And if you tell the patient that this has to be done digitally, regardless if you do it at home or in the office, and a lot of offices, what they do is they actually tell the patient to come 15 minutes earlier. So it's usually something like, either you do it at home at your own time, in bed, and with your morning coffee, or you come 15 minutes earlier to the practice. And usually, most of the patients would never say yes to sitting an extra 15 minutes in the waiting room, and they would rather do it at home. And when you give them those two options, they would definitely opt to doing the forms at home and not actually having to do it in the office. So again, it's really about the way you word it. It's really about the way you present it to the patient. Again, it's not a favor for the office. It's actually more important for the patient than it is to the office at the end of the day. So once the patient understands the real meaning of this and why you're actually doing it, and obviously again, communication is very important, and the more you explain to the patient, instead of just sending them a link without them even expecting it, if you're talking to them on the phone, you can tell them, please check your inbox. I've sent you an email from the office. This is your new patient forms. We would like to fill them out. So that way the patient is aware of what's happening, so he's not surprised with a random email in their inbox. And obviously, once they understand the importance of it, then rarely patients ever come in actually without filling it out. They would always take the time to fill it out. And again, since it is fillable in different stages and can be done over days and not done in one go, it really makes it a difference, and the patients actually do put the effort to fill that out. So obviously this would work in an ideal world. Patients, and unfortunately, realistically speaking, some are going to come in without filling those forms out. And it could be for many reasons. It could be, one, patients don't have an email, or patients didn't get the email, you forgot to send it off. It could be just any real reason, honestly, and sometimes patients just don't want to do it. So once they actually do come into the office, and that's the top 3 sections, you have 3 different ways of entering their information on Oryx. The best way from our feedback from all the different offices that have been using it, the kiosk is one of the smoothest and the best ways to do it in the office. So the kiosk can be is a link to my chart, which is the admin link. So it's only for the office basically use. So this is a link that you would not submit to you won't send it to any of your patients. It's just a link that is for the admins in the practice. It's a link that you can open on a desktop, on a laptop, on an iPad. It could be just any device that is sitting in your office. And again, iPads are a great idea because especially with the newer iPads, they're a bit bigger. You can hand it over to the patient. They can sit there and they can fill it out. The kiosk allows them to go through the MyChart experience. So it takes them through the visual yes and no questions instead of it being just a replica of what a paper form is. So it actually goes through the MyChart. It shows them the graphics, the animations, and obviously it's a much smoother flow. It's a much nicer flow, and it goes by really easily and very smoothly for the patients. So the MyChart would be the kiosk MyChart would be a great way to utilize that MyChart flow in the office, even if the patient does not have an email address. So that would be the one in the center. And again, obviously, you would be prompted to import the patient as soon as they're done with filling out MyChart. The second option would be the iPad application, which is Oryx Docs now. So Oryx Docs is available not only actually on iPads, now it's available as well on Androids. So if you have Microsoft Surface, if you have an iPad, if you have an Android tablet, whatever type of tablet you have in the office, there's an application that's called Oryx Docs. You can download it, and it will give you access to not only actually the forms, but a whole lot of different features as well that we'll cover over the presentation. But basically, one of the first things that you will see on the Oryx Docs is actually going to be the medical dental questions and the confidential information that the patient can actually fill out electronically in the office on the tablet. The difference between the second and the third, so the kiosk and the iPad, is just simply the way things look. So again, MyChart is going to be very visual, graphic. It's going to be that picture-based yes/no questions that the patient will see. There's the animations. That would be the kiosk, versus the iPad is going to be a very straightforward, simplified view that will look very much like a paper. It will have a question spelled out with two buttons that say yes and no. And that is usually the best option for the elderly patients, people that are not very comfortable with technology, that want to just quickly read something and just click yes or no without going through fancy graphics and crazy animations. And they just want something that's very straightforward, very easy. And a lot of people actually, what they do, especially with the elderly patients, that they usually have either an assistant or someone from the front actually sit down with the patient on the iPad and go over the questions, and they help them fill out that form. So the Oryx Docs is not graphical. It's very basic. It's just a spelled out question with yes and no buttons. So it's very different from the kiosk MyChart flow. And again, you will know your own patients. You know which patients are going to be more comfortable with the crazy graphics and who's going to be more, maybe more, uncomfortable with technology and would rather do something that's very simple. So you will know when to give the patient either or, and they both will work on an iPad. So it's really up to you which one you would just simply open. So you can bookmark your MyChart link and you can open your Oryx app. And depending on which one of the two you feel the patient would be ready to experience, then that would be something that the front ladies can actually decide on and actually hand the iPad to the patient with either or open. Last, which would be the least favorite of everyone, is actually the paper forms. So the paper forms, especially if you have access to Dr. Kois's medical and dental history questions, they're actually numbered the same exact sequence as the questions on Oryx. So you will notice that if you go to question number 25 on the medical history questionnaire on Dr. Kois's paper forms, it will be the exact question number 25 on Oryx. So that way you don't have to worry about finding and trying to match the questions between what's on the paper and what's on your screen. So you'll actually be able to just match those questions, and you'll be able to just simply hit no to not answered, and it will answer all the rest of the questions with no. So that's something obviously that you will see tomorrow in action on the actual software. So it's less theoretical and more basically going to be applied on the software. But just so you know, paper forms are an option. However, obviously that will be an extra step or extra work for the team. And again, obviously, if the patient comes in with the paper forms filled out, then the doctor will not have access to this information prior to the patient's appointment, and that will obviously not use the feature up to its optimal, obviously, capacity. So the best case scenario is definitely going to be completing the forms at home and having all this information pre-filled for you, so that way you will be able to tell the patient case, who's coming in, especially obviously for new patients, and as well obviously for patients that are coming back for their Recare, for their Hygiene, and you would like them to update their medical history forms. That would be a great place as well to do it on my chart, so that way you'll get them all digitally filled out. So that's really up to the office to decide if they would like to do it for all the patients coming into the office, or they would like to do it only for new patients, and then with every comprehensive evaluation, send out a medical dental history update. It could be done in either or, and that's something, again, that we'll go over in details tomorrow. But for now, at least, that's basically the different 5 ways of how to add a patient to your systems. So once you actually once you import the patient from my chart, you do have the different risks that are associated with the 4 categories. So just for everyone who's not familiar with those circles here, the P stands for perio, B stands for biomechanical, F for functional, and D for dentofacial. So gum, tooth structure, jaw, and then obviously smile characteristics. So that way, every single patient would have a risk associated to every one of those 4 categories. So you will see some patients, let's say like patient A has really high risk with their perio health, and a moderate risk with their functional. Let's say patient B has some problems with their biomechanical, their tooth structure, but everything else is low risk, versus patient C, for example, is completely healthy. And all of those patients, what this will allow you to do is you can actually designate every single one of those patients who would be a great provider in the office to actually see that patient. So for example, a patient who's fully healthy might actually see the hygienist directly and probably will not need the doctor time too much, versus, for example, a patient who has high risk perio would probably want to see the specialist if you have, let's say, a periodontist in the office. So what really this helps you is that you can tell the patient case beforehand, and then you can actually prepare for the patient. You can schedule based on the risk that the patient is coming in with. You're not surprised if a patient comes in all of a sudden and you're like, you don't have time to actually spare an extra 10-15 minutes with the doctor because your schedule is fully packed. That way you don't end up pushing everyone else behind because of that extra 10 minutes. So if you actually import that patient a couple of days in advance, at least, you can check the patient out, you can see what the risk is, and you can actually decide whether or not, if you have, let's say, an extra opening after that patient, if there's a lunch break, if there's any way to extend that appointment a bit longer, if you see that's a patient that has a lot of high risk or moderate risks that you know that the doctor will need more time with. Because it really obviously makes a huge difference between having a healthy patient come into your practice, the doctor needs, let's say, 15 minutes, 20 minutes with, versus a patient that comes in with high risks, a lot of problems, a lot of previous dental work that has gone bad, and they'd probably need at least 40 to 50 minutes with the dentist, basically as a comprehensive valuation. So obviously the amount of time that you will need with every one of the assistants, dentists, hygienists per appointment will vary depending on the case itself. So that way, when you actually see that patient beforehand and you can tell if it's going to be a healthy or an unhealthy patient, you'll be able to tell if it's a patient that will need more dentist time. So you want to make sure you don't double book that dentist. What other offices actually do is a lot of the new patients appointments are half basically with doctor, half with hygienist, because they would do the cleaning as well in the same appointment. But for a patient that is already high risk and you know that the doctor is going to need a lot of that time or most of that time, you probably want to either give him another appointment on the same day with the hygienist, or maybe call the patient and tell them that, look, it looks like we're going to need some extra time with you. It looks like you have some previous works that we need to look at. So the dentist is going to need some more time with you. So we're not going to have enough time to do the cleaning. Let's schedule you, for example, for the week after. So that way it really gives you a good control over your schedule, instead of you getting completely surprised and just ending up with, again, 10, 15 minutes into the next appointment, pushing everything forward and delaying the entire schedule because of that patient that came in at the beginning of the day with a high risk, or again, a lot of things that the doctor had to look at. And that comp exam, instead of taking 20, 30 minutes, ended up taking 50 minutes, for example. So it really gives you a good control over your schedule. And as well, obviously, it gives you a very good idea about the patient walking in, because at the end of the day, not only do you have a good idea of their dental risk, but as well, you know, if the patient is fearful or not, if they have anxiety when it comes to dental work, have they had any previous bad experiences. All of that as well prepares you to know how to handle and how to deal with a patient. If it's someone who's always anxious, maybe you want to make sure that the room already has the headset in there. They already have maybe some calming, videos playing on the screen. You can actually be so well prepared for the patient based on just that very basic questionnaire. And another really big thing as well is obviously the medical history, allergies, high risk conditions that would need pre-medication. And I think one of the really great examples that Dr. Kois usually gives when he talks about the importance of the medical history is actually that one patient that came into one of actually the practices from the Kois graduates, is a patient that came in with an allergy that the office was not aware of. So when the patient was filling out the forms in the office very quickly, the patient missed to say that they actually were allergic to grape flavored products. And actually, after the patient left the practice, the hospital called the office, and they told them that the patient actually had an allergic reaction and they're in the hospital, they're having a seizure, and they were wondering what could have caused that kind of allergy. And it turned out that actually the practice was using grape flavored rinse as part basically of their cleaning protocol. And the patient actually had a reaction to that rinse in the office. Because the office was not aware of that allergy, the patient just quickly filled out the form, didn't think that really something grape flavored is something that the office needs to know, and he just skipped it. And because of those forms, because those forms are filled out prior, the patient is prompted to ask and is asked about so many different things, it's really harder to forget or to miss any of those questions. So that way, if a patient comes in with such an allergy or any kind of allergy, really, you know that you need to be able to serve that patient, to be able to give them the care that they need, and making sure that obviously what you have in the office is compatible with the patient's whatever allergies that they have. So again, there are a lot of benefits of having those forms entered previously before the patient comes into the office. And the more patients fill those forms in, the more benefits you will get out of it, and you will see and you'll understand how nice it is to actually be able to tell what kind of patients are walking in. And we'll go over that in a second on the actual schedule, but as well, you'll have a very nice idea of how your day is going to be. So speaking of the schedule as well, and again, for offices that are using already our software, they're very familiar with our appointment card. And that circle that you see right here is actually the dental risk of the patient. And you'll be able to see this on your entire schedule on the day. So when you're looking actually on, let's say, tomorrow's schedule, or if you're doing your morning huddles in the morning, you can actually take a look at every column and see which patients are coming in. Are we going to have any high-risk patients? Are we going to have any low-risk patients? How's the day looking? So you can actually be prepared for your patients, and you can be even mentally as well prepared that you know that, for example, after lunch, you have this high-risk patient that will probably take up a lot of your time. So you can actually be ready for every one of those patients. I'm going to start with the checklists, and how to utilize the checklists on the schedule and throughout the software. So tying it back to how I started the presentation, and again, the idea of consistency in the office and the idea of having systems in the practice to be able to better, first of all, obviously maintain quality, and as well to be able to assess the progress and the patient experience in your practice. So one of the main things that Dr. Rania worked on when she first started the idea of Oryx was to create as many checklists and as many systems as possible to help guide the entire team to a more consistent and more a smoother basic experience for the patient. So one of the main things that are implemented in the software, and you will see this on your schedule, is the checklist. So you have the pre-appointment checklist, you have the check-in checklist, and the checkout checklist. So on the schedule, every single appointment will have those 3 checklists attached to it, and that will ensure that every single thing that is supposed to be done for a patient experience in the office is actually being done on time. So the pre-appointment checklist contains a few items that are generally applied to an appointment. So those checklists are, again, general checklists, meaning that some of those items may not apply to the actual appointment that the patient is coming to, but that is just as a rough, basically general list for the entire team to be able to use to be able to ensure that every single time every single patient has all the information and all the necessary paperwork done for their appointments. So starting with the pre-appointment checklist is usually the front desk or the admin's task. So you would go in and you import history. So importing the history is importing the MyChart forms. So when you actually have the patient to fill in the forms, you get that pop-up on the schedule. It asks you to import the history of the patient. So that would be something that you can check. Then you have import records. Import records are usually for patients are coming as a referral from another office, meaning that they have a referral form, they have authorization forms from the other office. They can come with a panel, they can come with previous x-rays. So all of that information is considered to be records, and import records just ensures that the patient, when they send you all the information, you've actually added it to their profile. Appointment reminder, specific, especially if you actually called the patient and if you talk to them verbally, or a patient's coming same day, next day, and it's something that you did yourself, you can check it off. Verified insurance eligibility. So as we said as well, the confidential information on MyChart contains the insurance section, and that's something that is really important to encourage your patients to fill out. It really makes a big difference if the patient actually has all that information. Sorry, I'm just going to go back to the slide. If it has all the information filled in, because if you have all the insurance info pre-filled, you can actually add the insurance, you can submit for eligibility check, you can get all those benefits in and confirm that all the information is there. They still have benefits to use during the year. So it really gives you so much information even before the patient comes in. So you can actually, even when the patient walks in the door, you can tell them, hey, look, it looks like you've actually used up your pano this year. So we're not going to do a pano for you. So you're actually already so prepared for the patient. You have all the information that you need, that the patient actually, when they come in, they can feel that you are prepared for them. You've looked through their files, you've looked through their benefits of the year. So it really gives a very nice first impression, especially for new patients. And as well, obviously, it gives you that extra step, that first step to having that patient profile ready for just billing out, instead of having to worry about adding the insurances on the spot as the patient is basically staring down at you while you actually walk them out. And then third, obviously, last item on that list is the pre-medication reminder. And it's very important, obviously, to remind the patient that they need a pre-med for their appointment. So all of those items can be checked on the list here. If one of them doesn't apply, so if a patient does not require pre-med, you can just check NA, so not applicable, and it will automatically just check that mark on the top of the pre-appointment checklist, and that will add as well the check mark on the appointment card itself. So when you're looking in the morning when you're doing the morning huddle, you can look at your appointments and you can tell which appointments have been successfully like the entire checklist has been done and the appointment has been prepared, the patient's prepared, the chart is ready for it, or if there's anything missing. So what a lot of offices do actually is that they take a look, let's say 2 days in advance, they quickly scan the schedule, they look which appointments still are not checked and what's missing. You can add your notes onto the appointment. You can basically obviously keep any of those items unchecked. And actually one of the really nice things that hopefully very soon we're implementing is, and we'll talk about this in a bit, the task list. You'll be able to actually add some of those items into your task list, so that way you can actually add it as an item to be done, or to add a due date, to add the reminder. You'll be able actually to push those over to the task list. So for now, if you actually check them all off, it will highlight the section in green. It will add the check mark here. Otherwise, you will see this in gray on your appointment cards, and you will basically be able to tell which items that were not done for the patient's appointment. So as I said earlier, the pre-appointment checklist is usually for the front. The check-in checklist is usually for the clinical or the back team. So it's usually done with the patient either in the chair, or at least someone basically from the assistants, from the hygienist, someone walks up to the patient and actually goes over those few items. So first and foremost is to review the records. So someone would review the medical dental history with the patient. They would review anything that they've sent over from their previous dentist. So reviewing the records, check. Review and sign the visit plan. And that's something that some offices like to do verbally. And it's very important, especially for appointments that are complex, long appointments that have a lot of procedures happening. It's very important for the office to communicate with the patient on the day of the appointment, so that the patient is aware what's happening. So a lot of people actually sit down with the patient when he's in the chair, and they just verbally communicate with them and tell them that, okay, so today we're doing the extraction of those 2 teeth, and if we have enough time, we might do a filling on the top tooth. So whatever basically the plan is of that day, it's very nice to be able to, again, verbally kind of explain to the patient, so he's expecting what's happening on that day. And that way, at least, again, you can either sign it off if you really need a signature on that day, if there's anything that's like very serious surgeries happening that you want a signature on them, or at least you can verbally consent with the patient about the visit of the day. Third, obviously, is the consent forms. So all the procedures that require consent forms are already on your iPad, and we'll go over that once we get to that. But you already have consent forms that are linked to your treatment plan. So every patient that requires an extraction, a crown, an implant, a bridge, whatever it is, there's already forms that are automatically populated on the iPad for the patient under the patient's profile. So you need to make sure that those are signed off, obviously, before the procedure has started. And then last but not least would be the clinical, basically last verification that the patient has actually taken their pre-meds. And it's just important that you just confirm, at least verbally with the patient, have you taken your pre-meds? Yes, you can go ahead and start with your procedures. So those 4 items would be checked by by the back team. So that way you can confirm with basically the patient all of those that they were done. And this will actually obviously check this off as well in green. So you can tell that the entire checklist, the check-in checklist, has been done by the clinical team. And then last but not least would be the checkout checklist, which would be mostly done by the front. And this checklist specifically is really up to the office to decide on what the best flow that works for the entire team. Some offices split it up. Some offices like to do it all in the front. It really depends on what your actual office flow is. But at the end of the day, billing procedures, and ideally the clinical team would actually be completing the procedures. So it actually, in other terms, post or walk out the procedures that were done in the back. The actual front team would actually be billing the procedures. So they'll be actually billing them out, they're adding them to the ledger. So this would be something that the front would do. Purchase products. So if you do sell any of the toothpaste, toothbrushes, the rinses, any other carry-free products, whitening products, anything that you sell in the office can be purchased straight through here. share clinical reports. So if you are sharing with the patient their risk assessment, their concerns, and again, we'll cover all of those once we get to those sections in the clinical module, but all of that can be shared straight from the schedule, including printing out prescriptions. Scheduling the next appointment is very important on that checklist, and it's something that a lot of offices love to have as a visual reminder for the friend, is to make sure that every single patient leaving the office actually has the next scheduled appointment already booked. And then last is going to be sending that lab case in case that this patient's next visit is going to be requiring a lab case to be basically sent out and to be done in a lab. So that, again, this checklist right now, it's not customizable as of today, but we are working on having it customizable for our offices. So that way we know and we're aware that obviously every office has their own flow. Some offices would like to add an extra checklist item, others would like to remove one. So we've heard this as a common request from a lot of our offices, and definitely on our list, and will definitely be coming out hopefully very soon. So offices will be able to customize this list. And again, soon it will be as well linked to your task list. So you'll be able to actually push some of those into your task list, and you can get reminded about those items as you go through. And you can see that the appointment card here, the background is white for anything that's not checked out. And once you check out an appointment completely, it turns into that dark gray. So when you're looking at your schedule, you can quickly tell appointments that are coming up with a white check mark, meaning that their pre-appointment checklist has been done. The appointment that's been checked out with a white check mark, indicating that the complete checkout checklist has been done as well. So at the end of your day, it would be perfect, obviously, to see your entire schedule in this dark gray with that white check mark on it to indicate that all the patients have been checked out completely, nothing was missed out, and everything was done. One thing that is very important to keep in mind is that those checklists are optional. They're not mandatory. The system will never force you to use them. Some offices love using them because it gives the office, every single team member, accountability. It gives them a responsibility. It kind of gives them, like, it's goal oriented, it's task oriented. So every single one of the team members would know what their tasks are, what they're supposed to be checking off that list. So it's never kind of this mystery, who's going to be doing this section, who's supposed to be signing this form. So it really is nice to have this kind of like a list of tasks that are agreed on and pre-discussed by the entire team, so everyone is aware of their own tasks and their responsibilities when it comes to every one of the 3 stages of that appointment. Some offices love it as a visual reference. So we have a lot of offices that kind of just open it up and they kind of visually be like, yep, done that, yep, sure, okay, moving on, without actually checking them off. So some offices like the idea of having a checklist and having one item at a time. It's almost a satisfaction of everyone seeing those items checked off and being done and perfectly completed. Other people like it just as a visual reminder, just to make sure that everything was done as things are happening in the office. So it's really up to you how you would like to use this. But again, both are optional, both are valid options. It depends on your flow, it depends on the team. And again, it will soon be customizable. You'll soon be able to change those items in here as well. And hopefully as well, you'll be able to track all of this by user as well. So that gives you the flexibility of setting up a system for every single appointment that is going to be added to your schedule. So that way you know exactly who is responsible of every single task in your office. Moving on to the card that you're seeing here. Again, a lot of our offices that are on this webinar that already use the software are familiar with what we're looking at. And again, it's kind of blown a bit into a bit out of proportions, larger items, just so that you can see them easy on the screen. But technically speaking, for anyone who's not using the system yet, this is what your appointment card is going to look like on the schedule. The vertical line that you see on the side here is going to be your provider color. So every single provider can be assigned, every single appointment can have a provider assigned to it, and can have multiple providers, or can have assistant provider, hygienist, dentist. So you can actually split this up by the length of time that every single one of those providers need with that patient. So that way, especially if you're running a schedule that works with double booking, so you actually double book the providers based on where he needs to be available, then that would be the perfect way to actually utilize visually a very easy way to tell where the provider is going to be, when is he going to be available, and when is he going to be busy. So that vertical line will get cut off exactly based on the duration. So you can say that the assistant is going to need 10 minutes with the provider, then with the patient, the provider is going to need, let's say, 20 minutes, and then extra 10 minutes is going to be with the assistant again. So that way you know that you can schedule that next appointment for that provider that could overlap the last 10 minutes of, let's say, the previous appointment. So it's really nice. It's very visual. You can assign the colors per provider. You can assign hygienists different colors. You can even assign assistants different colors as well. And that really depends on how you usually run your schedule. Some practices would like specific assistants to be available during specific appointments or specific procedures. So if you have assistants that are trained to assist during surgeries, then you want to be able to indicate that on your schedule. So you can actually give that specific assistant a different color. So you can actually set that up in whichever way you would like. And we have other offices that have assistants colored in just one basic color, so let's say a gray or a blue, so that way you know that this is just any assistant that's available will need to pop into that operator, let's say, for that last 10 minutes. So it's fully up to you how you would like to customize it, but it's flexible for you to do so. The colored bar that you see under the name, which is green here and light gray here, is actually the status of the appointment. And we'll see this on the actual software when we get to that with Nika tomorrow. You have obviously different statuses. So you have seated, arrived, late, checked in. So you have all those different statuses, and that bar will change under the patient name to indicate the status of the appointment. The time of the appointment, what time it starts. These are graphics that will indicate what kind of procedures are on this appointment. And you obviously have the full list of procedures as well that are attached to this appointment. The icons that you see in here are shortcuts to the patient's pages. So that way, instead of having to change the patient and then go into the exam, you can just simply click on the tooth and it will just drop you straight into the exam page of that specific patient. So it just creates a very easy flow of just going into different pages of the patient's chart without having to click so many times to get to different places. The phone number is available very easily as well. If you just hover over the phone icon, it pops up the phone number right here. So if you want to call someone, you don't need to open up their chart. And as well, medical alerts. If you hover over it, it gives you the medical alerts that are associated with this patient. If the patient needs a pre-med, you'll have a circle around it just to indicate that this is a patient that requires a pre-med, and gives you a very easy visual on the schedule just to confirm that this patient actually got a reminder for their pre-med. So again, the color of the background will change to the dark gray once the appointment's checked out, completed. So this is what you will be seeing on the schedule on the actual columns in your Oryx schedule page. So speaking of appointments and confirmations, the system is built in with reminders. So basically, every single patient on the system that has an appointment will get a reminder for their upcoming appointments, both by email and text. And the frequency of those reminders are up to you to set up in whichever way you want. You can set up reminders for long-term, for example, appointments, let's say 3 weeks in advance, then 1 week in advance, and then maybe on the same day. A lot of offices like to send the patient reminder, a text reminder 2 days or 2 hours in advance, for example, or 1 hour in advance, especially if you know that your patient pool is usually like it's full of very busy people. All of them are full-time, basically employees. So you want to always remind the patient just this one extra time on the day of the appointment. So you can actually set it up hours, days, or weeks in advance. So it's really up to you to how often those reminders go out. Again, both text and email. And in both cases, both text and email will automatically confirm your appointments on the schedule. So meaning that you don't have to actually, you don't have to synchronize to different systems, especially when you have a third-party software doing the confirmations for you. It's not always synchronized with your schedule. So because this is a built-in system, your reminders are going to automatically confirm your appointments. So when you look at your schedule, you will see, as we saw earlier, that bar under the name would turn green. Otherwise, it would be gray if the appointment is not confirmed. Once it turns green, that means that the patient has confirmed their appointment. You can obviously do it yourself. So if you actually called the patient, you talked to them, and they said, yes, of course, I'm coming, then you can manually obviously confirm it. But otherwise, the system will send out those reminders, again, based on the frequency that you set it up. And once they text C, for example, in this case, it will confirm automatically that appointment on the schedule. So that way, the schedule is always going to be up to date. And again, obviously, because this is a cloud software, you will see those confirmations coming in real time and updating your schedule real time. So it's not going to be lagging. You don't need time. You don't need to sync your schedule or anything at all. It will automatically be updating real time your appointments on the schedule. In addition to your reminders, you do have as well the two-way communication. So the two-way communication is both allows you to either text or email the patient straight from the software. And the nice thing about texting, it's almost like a chat system. So the patient can reply back to you. You can text them back. Hey, please make sure you take your pre-meds for your next appointment. Thank you for the reminder. Make sure that you get your night guard. It's really nice because it really, and again, it's fully real-time updates. So the moment the patient texts you, you'll get it back, and it will just tell you that the patient has basically texted you. You get a notification on the schedule, and you can actually respond back on the spot. So it gives you a very easy way to communicate with the patient, and hopefully reducing all that time over the phone. So it really gives the team, especially the admin and the front team, more time to focus on other things instead of having to be on the phone all the time, calling people, reminding them about their pre-meds, about their, again, night guards, anything that you would like the patient to come. If you want to make sure that they come 10 minutes earlier, that's another way that's really nice to do. If you notice that the patient did not fill out their forms, a lot of our offices just text the patient on the same day or the day before saying that, hey, we did not receive your forms yet. Please either fill them out before your appointment or come in 10 minutes earlier. So it's really nice, again, just reducing that amount of time that you spend on the phone calling people by just simply texting those people out from inside the software. And since obviously it's going through the software, it's already synced with your patient profile. So you have the full documentation of all the communication. So you don't have to worry about having to always pop into the clinical notes, type in a note, a communication note with the patient. It's already there. It's already in the communication activity. So it's fully synced for you. So you don't have to worry about keeping track of third-party softwares. You don't have to worry about keeping everything synced together at the same time. It's already here for you to utilize, and hopefully, again, just reduce the amount of work that you have to do due to all the follow-ups that you have to do with your patients. And actually, I think one of the nicest ways as well that this has been used by some of our specialist offices, or especially after surgeries. We have a lot of offices actually that text people just after a surgery the next day, checking up on them, making sure that they're doing fine, if they're taking their meds. It just basically feels very personal. And honestly, these days, patients, especially the younger patients, they would rather a million times get a text than actually being called on the phone. And especially with people that are full-time employees, they don't have time, they're in meetings all day, they don't have time to pick up the phone, they'd rather not pick up the phone, honestly. And especially millennials these days, they definitely prefer to be texted and not actually called. So I think that would be a great way to communicate with patients, get a response back, and actually, again, reduce just the amount of time on the phone for the front. So the digital workflow is our next module or our next section. So the digital workflow is going to show you how that entire section of that clinical and back team is supposed to be linked together, how it all works together, and how it all basically works with the front and how it works with the patient forms. And you'll notice as we go through, you will notice how the risk is going to be integrated, how the forms are going to be integrated, and how, again, a lot of the different apps, hopefully the third-party apps and all the different tools in the office that you would use, hopefully will integrate into Oryx and reduce those third-party integrations that are usually required to run the practice smoothly. So the first thing I would like to stop at is actually going to be the Oryx Cam, or the Oryx camera application, which is both an iPhone and an Android application. And a lot of our expert users have been using this app, and we've been releasing updates, and there is actually a new update to the application that's been released actually last week, I think. So for anyone who's using the app, please make sure that you update your Oryx Cam. So the Oryx camera is synced with your Oryx application. What's really amazing about this app is that it's fully HIPAA compliant. It does not save any of the images of your patients on the phone. So what happens is that basically you log into your account using the same username and password that you use to log into Oryx, and it automatically syncs with the patient list that you have on your Oryx software. So when you open up your account, you will see all the patient names in here. You can search for your patients. So it's the same exact list that you have on Oryx, and you can select which patient you would like to take pictures of. And you can take extraoral photos, close-ups, you can take extraoral full-face photos, intraorals, lab communication, additional photos. You can take a full range of different photos on Oryx camera. And you do have a template that you can follow either fully, or you can decide which pictures you would like to take. So if you want to do a full smile analysis, if you want to do an ortho case, then you can take the full series of pictures from both the retracted, the full face, the 12 o'clock position, the laterals. You can decide, if you don't want them all, you can decide which ones you would like to take. And once you do take that picture, you do have a reference photo of what the picture is supposed to be like. So you can actually, once you take the picture, you have an icon here on the top. You can click on, it shows you what ideally the picture should look like versus what you've taken. So if you're satisfied with the picture, you can just check the green mark, and it will basically it will add it to the patient's list of photos. And once you're done with taking the pictures that are needed for this patient, you just hit the sync button, and it will upload all those pictures to the patient chart. So that way you don't have to worry about taking out that SLR camera, taking that entire series of pictures with the big bulky lights, the flashlights, the backdrop. It really simplifies that process of taking pictures, and hopefully that will help simplify it to a way where actually you can ensure that every single patient has some of those photos taken. And really the main idea, or the main reason behind this app when we first started this off is that, again, Dr. Rania wanted to make sure that there's a consistency in the patient basically profile. And we want to make sure that all the patients have pictures, at least the bare minimum. And it really depends on the office what they decide to actually take, but it really just becomes part of the protocol. So when a patient comes in, they walk into the office, they take a pano, and they take, let's say, a full face, full smile, a full face repause, and maybe a lateral. And you can decide on taking 2 pictures, you can decide on taking 4 pictures. So whatever you think is enough as the minimum pictures you need for a case, but at least have it as part of your protocol. So every time a patient comes in, especially the new patients, always take a couple of pictures so that they're part of your patient chart. So that way you can actually always refer back to. And I think one of the really important things, or at least the benefits that you get out of this, is that no matter what happens, no matter at which point in the future, you would need to fall back to the pictures to refer to how the patient came in as. If you want to make sure that nothing is missed, you want to review the case, you know for sure that the moment that you go to that patient profile, you're going to actually have all that information in that chart, and it's not going to be crossing your fingers and hoping that that day that SLR camera was outside the box. So it really helps you you, just making sure that all that information is always available for you at any point in the future. And another really amazing, I think, part of this app is your photographic guide that you see here. And it's already built into the app, so it really helps, especially for either temp assistants or new team members that are not, maybe did not have enough practice or not have enough experience in taking pictures before. It is a very nice photographic guide that goes over how to take the best pictures possible, both using they both apply using the camera on the phone and as well the SLR camera. It goes into the focal length, how far apart you should be probably from the patient, how to, for example, how to set up the mirrors, how to defog mirrors if you're taking any of the retracted or occlusals. It really goes into a lot of those details that are really nice tips and hints for people on how to better take those pictures so that you have really nice selection of photos when you're reviewing the case, so you can actually see and use for diagnostic purposes, and obviously as well to have for future reference when you're going through the patient case. And actually I think one of the scenarios or one of the stories that have triggered, I think, the actual development of this app was actually one of the cases that actually Dr. Rania had in her office, when one of her patients called the front saying that the hygienist actually broke their teeth while cleaning, were actually cleaning their teeth during the Recare visit. And it was really scary as an idea. It's like, how could it be that a hygienist, while doing just a regular prophy, actually broke the patient's bottom anteriors? And it was really nice that it happened, actually, because there is a system, and because the office always had pictures of the patient before they actually start. They actually went back to the patient's chart and they realized that those pictures, those occlusal photos, they show really bad calculus at the bottom teeth of the patient. And they realized that actually what quote unquote broke off was actually just a big piece of calculus that the patient has been so used to after so many years. So it really was easy to be able to tell the patient, no, actually, I'm going to send you the photo. Here's what your teeth looked like. This is what you see in this picture. This is actually calculus. This is not part of your tooth. The hygienist actually was doing a great job with cleaning those remaining calculus in your, basically in your bottom arch. So it was really nice to have this kind of photos to refer back to, and to be able to, first of all, obviously for yourself as a practice, to be able to tell if there were any mistakes that happened. And as well, it was a very nice reference that you could have, that you can send to your patient as well, and you can tell them, hey, this is what it looked like. This is not teeth, this is actually calculus, and this is basically all of this had to be cleaned out. So again, in a lot of cases, it's really nice to have photos to refer back to, and even as progress as well. I think it would be great for a patient to see what they looked like a year ago or 2 years ago when they first came into the practice, versus, let's say, a couple of years in, after some let's say perio maintenance, after a lot of whitening, whatever it was that they came into the office to do. It's really nice for the patient to be able to as well see those pictures in the future. And something that we'll get to in a second as well is that every single piece of ancillary, basically photos, x-rays, anything that you actually collect as well will feed into the patient's risk assessment. So when you print out that report for the patient, it's fully personalized with their own photos. And we'll get to that in a second, but it would be really nice. The more information you have and the more x-rays and photos that you have of the patient, it will make that report so much richer and so much nicer for the patient and so much more personal. So this is another thing that, this is another alternative. So if you don't want to take the pictures with with the Oryx camera, or if you do want to do a full ortho case, the nice thing is that if you do end up taking pictures with the SLR camera, it's very easy to upload. So you can see that what you see on the page here is actually the photo page on the Oryx docs. It has that same exact template that you have on your phone. So, and you'll be able to either drag and drop straight from your folder, or you can actually drag them, as you saw earlier, onto that right side thumbnails, and you can actually just drop them in here. So you can do it in both cases, in both ways, and it's very easy. You can see, you can either drag a bunch of images into the right side here. And this is really, really nice, because I think everyone that uses an SLR camera knows that the images are saved in like weird named formats. So it says like IMG underscore 2035, whatever. So it really just this gibberish basically name that it's really hard to tell which picture is which. So that's something that is very easily basically taken care of by just simply dragging all those images to that right hand side. And when you drag them in, it creates a thumbnail for all those images for you. So that way you don't have to guess which image is which. So it creates a thumbnail. And those thumbnails are, again, just temporary for you to be able to view them. So you can tell which image is a full face, which image is a retracted smile. And then as the video basically showed you, you can just literally just drag them into the spot based on what this picture is. So you can just look for the full face Duchenne smile and you just drop it in there, and full face repose, just drop it in there, instead of having to figure out each image, open it up separately, try to figure out which one is the full face, and then drop it in. And obviously as well, if you do have them all in a folder and you know exactly which image drops where, then you can just drag them straight from the folder into their appropriate slot, and that way they upload into the patient's chart. So again, if you're using the Oryx camera, they automatically sync. You don't need to do anything at all. So once you take the pictures, there's a button that says sync profile. It uploads everything to the patient's chart. It does not save anything on your phones or your devices at all. So it's fully HIPAA compliant. It's double encrypted for all the facial photos as well. And if you open Oryx, you'll see all the images in this section already uploaded into their correct slots. So you don't need to do anything at all if you're using the Oryx camera. If you're using still the SLR, or if you want to do a full ortho case using the full setup that you have in the office, then this is a very easy way to upload all those images straight into Oryx without having to, again, open up every image separately and then figuring out where each one goes. Once those images are actually acquired, you will see them throughout the different clinical pages. And that's just an example of what the dentofacial exam is going to look like. So if you do take the close-up, repause, and smile, they'll automatically pop up large on your dentofacial exam, for example, because the system obviously knows that you'll be using the pictures to do your full analysis of the dentofacial or the smile characteristics. So you'll be able to see, for example, and you'll see throughout the different clinical module, you'll have access to those images as you go through the entire software. So meaning that as you're doing exams, as you're doing treatment planning, as you're writing your progress notes, you'll have access to the full series of pictures, x-rays, photos, intraoral photos, anything that you acquire, anything that you upload, you'll have access to the entire basically gallery of photos throughout the entire clinical module. And obviously we'll go over it together, but this is just a simple example of the more data you collect, the more pictures and x-rays you take and upload into Oryx, the easier it is for you to actually be able to view them and to reference them as you're doing your exams and your treatment planning in the system. Obviously, other than the pictures, you do have the x-rays on the system, and Oryx Imaging is an application that you would install on your devices, on the computers that will be acquiring your x-rays. So unlike a lot of the softwares that are local, since Oryx is a software, a cloud software, you won't be needing to install Oryx Imaging to view the images. So Oryx Imaging only is installed on the computers that you actually acquire or basically take x-rays on. So it's basically going to be in the operatories that have a sensor, or some offices take x-rays in all rooms. Other offices have a separate room specific for taking x-rays. So if you have only one room, for example, for x-rays, and that's where the patient is usually moved to take x-rays, that's the only room that you actually need Oryx Imaging on. Otherwise, once you're done, you take, let's say, a panel, and then you hit finish and upload, it will sync automatically with the patient's chart. So you'll be able to view those x-rays straight from within Oryx, from the Oryx software, and you don't need Oryx Imaging to actually view any of those images. Again, since it is a cloud software, everything is stored on the cloud. You don't need to worry about extra space. The Oryx Imaging software will require just a small storage just for local backups. It leaves a backup for a certain time, a certain period of time. So that way you always have a local backup, a copy of your images, just in case you don't have access to the internet. If there is, I don't know, you can't access Oryx for whatever reason, and you want to just quickly look at the panel and you want just access to a backup image locally, then that would be the only space that's required, because everything, once you upload, automatically syncs with the cloud and you have them all saved on the patient's chart on the cloud. So there's a lot of different sensors that we integrate with indirectly. There's some sensors that we integrate with through Twain. And again, you'll go over this tomorrow with Nika, a bit more over how to acquire those images. But just so you know that you will not need a third-party integration to acquire X-rays. You will acquire them directly into Oryx, and they will sync automatically on the cloud into the patient's chart. Okay, so we're going to start with the clinical section. So starting with the Oryx clinical evaluation, just to kind of go over what this section is going to be about, we're going to go over the different types of exams that we have on the system. So it's right now there's 7 exams, ranging from the radiographic, the TMJ, up to the dentofacial and smile characteristics. Each one of those exams are built to contain all the information you could possibly need to chart for every single one of those different exams or evaluations that you could do for as part of your comprehensive evaluation. And the way this section or this module of Oryx was built was to ensure that there's a systematic and guided way to do every single time a comprehensive evaluation. So what this helps with really is making sure that every single comprehensive evaluation is actually inputted and actually is charted the same exact way for every single patient. It's systematic. There is a very easy system to how things go, how it flows, what the logic is from one exam to another. It's really important to I think understand really how and why that order or that structure was actually created, and it really helps just systemize and actually create a very easy flow for both the doctor and the assistant. And I think this is one of the main struggles that a lot of the practices usually have in the clinical team, is that especially for a comprehensive evaluation, the doctor would start charting or would start saying out some conditions that he sees right in front of him completely out of order, or just basically random based on what he sees first. And then the assistant is trying to keep up with the doctor, trying to catch up with him. The doctor is already ahead and she's still trying to chart something else. So then obviously most of the time the assistant reverts to a paper and pen, jots all these down, and then tries to actually fill that in between patients or during the lunch break. And that really goes against the idea of having an easy flow. So the idea is that this exam is built, or this flow of exams is built in a way that will hopefully help organize, again, the thinking process, the way a comprehensive evaluation is done, what are things to look at systematically one after another, and to help as well the assistant be prepared for what's coming up next. So it's not just, it's not random conditions that are being charted as things come in, but they're actually a very structured way, a structured flow of what is going to be charted first, what's second, what's third. So that way the assistant is always prepared to basically catch everything that the doctor is throwing at her and actually chart them in their correct places, instead of having to, again, revert back to a pencil and a paper and try to then do that at a later point. One of the main huge, I think, differences between Oryx and every other software on the market is the way that the evaluation or the comprehensive evaluation of a patient is actually separated from the treatment planning module. And this is something that I think some of our existing users understand and have been utilizing to its optimal, basically, I think, possible actually outcomes. And some of our users that are considering actually transferring over to Oryx and starting to use Oryx as their practice management software, it's really nice to know this. And it's very important to keep in mind that the evaluation, the comprehensive evaluation that is on Oryx, that we will see today a bit, and tomorrow you will see in detail on with Nika, you will see that it's really driven by observation more than actual diagnosis. So the idea is that the evaluation that's on the system, you will see it's actually, even the terminology that's being used in the exam is more based on what you can observe, what you can see. So that way you're not trying to chart and treatment plan at the same time. You're not trying to diagnose at the same time. You're just simply taking a step out away from that analytical, I guess, state of mind, and just simply looking at what you have in front of you and charting everything very systematically and accurately into the system. Once you have that already charted in, you will see that there is going to be an automatically generated diagnosis. So it will give you a risk associated with every single one of the conditions that you've charted. So it will tell you what's considered to be a higher risk than something else. It will look at the different exams that you've charted, different conditions that you've charted, and it will tell you which teeth are going to be higher risk versus which ones are lower risk. And it will help you basically treatment plan better because you have a more general idea of what the full mouth is like versus a tooth by tooth case. So, and what this really encourages is more of a tooth, instead of actually a tooth-based dentistry, you're actually looking at more of a mouth-based dentistry. So you're looking at things a bit more of a global perspective. You're looking at the conditions, not only just looking at that one specific tooth, but it really gives you an overview of the risk of the tooth structure. It gives you a very good risk of what, for example, structural compromise that you're looking at, instead of it just being drilled down to a tooth based treatment planning. And that way, at least when you're treatment planning at the later stage, you'll see the diagnosis right in front of you, and it will help you better decide on what would be the best treatment plan for the specific case, not only based on the couple of conditions that you saw on a specific tooth, but you'll be able to see the adjacent teeth, the full mouth, and you can see the previous medical issues the patient might have had, previous dental works. So you actually have a very global idea again of what you're looking at, and it hopefully will guide you towards a treatment plan that is even better for the patient, based on so many different factors that will be again feeding into your treatment plan through again the diagnosis, the synopsis, and as well obviously the comprehensive documentation as you go through this. Before actually I dig into this, I really want to show you a video from Dr. Kois. I think it would be a great I guess view, and it will give you, I think, a great idea of how things actually would look like on Oryx. So I'm just gonna play this video for you, and this is really the base of the evaluation and the reason why we really started with the Oryx clinical evaluation. Oops. Sorry, I am having some technical problems.
Monday morning, you're back in practice, your first new patient is a very large individual. They sit in the chair. The first thing they tell you is, "Oh, I don't like to be tipped back." You say, "Well, okay, I have to tip you back a bit to do the exam. Let me know if this is okay." So I go start tipping the chair back, and the patient, "Stop, stop, 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 stop. Too far. I got to tip the button, come back up again." "Oh, too far? Yes, too far. Okay, well, let's kind of ease it down." I go back, too far, too far, too far, back and forth and back and forth. I got 5 minutes into this. I'm already getting exhausted. Then I go to do my exam, and I realize this man has like rubber cheeks. They don't even move. And I open as wide as you can. He opens 23 millimeters. He says, "This is all you can open?" "Yeah, everybody tells me I got a small mouth." So I go back to the distal of the upper second molar, And trying to get there is a chore because he's got this giant tongue. It's flailing around in there, and he salivates like a river. And I go back to the distal of the upper second molar, and there's now tissue from the tuberosity covering the marginal ridge. You can't even see it. So I take the Explorer because there's a huge DO alloy there, and I pick up the tissue with the Explorer, and I see a chip in the marginal ridge. Now, it's only in the amalgam, but it's a chip. Start thinking about it. I just take my Explorer, close that tissue back down, and I'm out of there. I'm not doing it. I don't want to do it. I'm thinking, it's going to be okay. The next patient, same chip. I go, easy exposure, nice person. I think we should replace this with a DO composite. It's on the schedule, ready to go. Now, that is not consistent. I didn't use the same criteria because I used the what? Sway. I made the decision by sway. No different than when you check margins. Sometimes you're more forgiving with the margins on the crowns you've done, with the margins on the crowns other dentists have done. I mean, you already know we are not consistent, and not being consistent doesn't allow us to be always emotionally healthy. With better metrics, so that much of our clinical decision making will hopefully not remain emotionally driven and empirical. We need to change this so that we don't keep making decisions that are up to what? Controversy. I am sure.
So yeah, so this is Dr. Kois basically just going over the idea of evidence-based dentistry and how it's important to be able to chart, taking that extra step backwards, taking that more of an objective view when you're actually charting. So that way, when you're actually looking at your diagnosis, you're looking at your diagnostic opinion at the end of the day and deciding on your treatment plan, you're not actually getting swayed by one factor or another. It doesn't matter who the patient is, doesn't matter how easy the day was, how hard it is. If you had a busy day, if you had a very rough day, it doesn't really matter all of this, because at the end of the day, when you're looking at the evidence-based or evidence triggered diagnostic opinion, you're actually just looking at a very scientific, objective view of the case, and you can decide the treatment planning based on that. So you can actually treatment plan based on the risk that you're seeing and not any of those external factors that could be affecting your treatment planning and the case that you're going to be presenting for the patient. So moving on from here, basically, the first thing and something that is very important is, again, that comprehensive documentation that we were talking about. The comprehensive documentation is going to come in different shapes and forms. And one of the main things is that you have different levels of information that you can actually chart on Oryx. And it gives you the flexibility of charting something at a very high level, very straightforward. So you can come in here and you can just click on the tooth and say, and you can click on this icon, for example, on the exam, and it says that this is a patient that has a root canal. So the system will automatically default to acceptable, and it will just keep your concerns empty. There's nothing to talk about. You're just charting an existing root canal because it was done previously in another office and you just need it to be on your chart. However, your second level of information can be what's the status, what is the state of that root canal? Is it acceptable? Is it questionable? Is it not acceptable at all? Is it something that you want to look into? Do you want to redo as well? This is very important to be able to actually chart that. So when you actually want to click on the tooth in the odontogram, and then you actually have those three icons that you can come in here. You can say acceptable, questionable, or not acceptable at all. Or you can just simply double click or right click, and I'm just going to show you that on the actual exam. So as you see it here, you can double click or right click on that tooth, and it will automatically pop up this this additional window for you that will allow you to go over your concerns. So you can actually say that, for example, you can click on the tooth, you click on questionable, or you can click on the word root canal treatment. Again, you'll go over this with Nika tomorrow, but the idea is that once you actually chart a condition, you can always double click or right click on the tooth number in here, and this will open up that additional level of information that you want to chart. And this gives you that extra third level of information. And you can say if there is irregulucency, if you see any, if the canal is overfilled or underfilled, is there any voids in there? You can actually chart all of this, and that way you're actually documenting that root canal, especially if it's not acceptable, especially if you have your concerns about it. It's a very great way to just drop all of this information into that one specific spot that will eventually actually transfer into your clinical notes as well. So this is very important to know about as you're treatment planning. Again, you have basically different levels of information. You can add as much information and you can document as much details as you like, depending on the case, depending on the severity of the condition. You can actually go in and actually double click on that tooth, and you can open up that pop-up and include more information related to that. And obviously, the more information you add, the more accurate diagnostic opinion is going to be, and the more rich that clinical note is going to show up or turn out to be when you go into the exam notes at the end of your visit. So that's one of the different levels, at least, of charting. Another thing that's really nice about this is actually the smart alerts that come from the dental and the medical history. And that's one of the really nice ways that medical and dental forms and the questionnaire actually feed into and link to the clinical module. And it's really nice because it's, I mean, everyone, I think, when patients come in, you quickly go through the medical dental history questions. You kind of very quickly skim through things that you really need to know, but it's really hard to actually memorize every single yes answer on that sheet. And it really makes it hard to be able to I guess, first of all, to tell what might be a problem when you actually are doing your evaluation. And as well, what's really sometimes frustrating patients is when you actually start asking them questions about things that they already answered. And usually their reaction is something like, I just filled that out, like I actually, like, so for them, it's like they actually took the time to fill those forms out and you didn't actually read them, although you probably have read them, but you obviously can't memorize every single question. So it just looks like you either didn't look at them, their answers are not important. And that's something that I think is really nice about this, is that it actually serves, I think, two great I guess, goals. And one of them is obviously it ensures that you don't miss anything as you go through the evaluations. The dental, for example, the dental alert in this case, for example, the DH that you see in here, which again, just to show you, it shows up next to every one of the sections. It will show you that there is a dental history alert, and it's showing you the patient said yes to broken chipped teeth, cracked, and for example, the patient had a couple of examples, a couple of accidents previously, and they've chipped their teeth, and they say yes to frequently food basically getting frequently caught between their teeth. So something that you won't miss, something that you won't have to ask the patient about again. You can just simply look at the notes. And the nice thing is that as the assistant is actually charting those conditions, she can actually prompt the doctor or the dentist to ask more information or to make sure that the doctor doesn't miss anything. So if the doctor, for example, is going through, I mean, obviously, in the case of existing restorations, maybe it's a bit harder to miss. But I mean, something like, for example, question number 20, which goes over the food that gets caught between the teeth. So that way, if the doctor is going through and he says that there are no concerns or there's no significant findings, the assistant can actually prompt the doctor by saying that, oh, doctor, by the way, the patient said that they have some food that gets caught frequently between their back upper molars. Do you mind taking a look? Or just in a way that it just reminds the doctor that there are concerns that the patient had mentioned. That's a great way to make sure that nothing is missed. At the same time, I think what's really great about this as well is that the patient actually gets to hear those concerns being said out loud, and it's really nice for the patient to understand that that time that they actually took to fill those questions out are not a waste of time, and they're not just this random form that got shoved in a drawer. No one is ever going to look at them. It's just a stupid protocol that the office has. But it really is important for the office to know you really are taking what they're saying seriously. It really is driving your evaluation as you go through it. So that way the patient understands that what they're concerned about, that their problems, that their issues are actually a very big concern of the office as well. And it really does give that extra, again, level of trust, that extra level of appreciation from the patient that that the office, although the office might have been doing this all along, but since the patient never heard it out loud, they don't know. So that really gives that patient the understanding of how important what they're telling you is, and how much it actually is a very integral part of your evaluation as well. So same thing applies to actually your medical history as well questions. So for example, in the TMJ exam, the medical history would pop up if the patient said yes to, let's say, head injuries. So that way, again, it's something that you don't miss. So when you first open up that exam in front of you, you will see that alert on the side, just to ensure that you don't miss anything at all as you're going through the evaluation. So that way, at no point do you actually have to reevaluate the patient for something that was missed. And I think that's actually a very good point to actually, I'm going to stop here to show you another video from Dr. Kois that's really nice, and I think he really does such an amazing job with explaining to all our users and the importance of that medical and dental history questions, and particularly having them done beforehand, before the actual patient comes in. So I'm just going to show you that second video. And
the purpose of a dental history is much more than most dentists. It's an opportunity to determine a person's oral literacy and at the same time save the dentist. For example, here's our question 20 on the Oryx history. It has to do with something simple, seemingly simple, like do I get food frequently called. For example, you've just completed a dental examination, and you now tell the patient they're fine, and you tip them up, and they say to you, now, doctor, what about this food I'm getting packed in between these two teeth? Now you have to put your gloves back on, tip the patient back in the chair, re-examine what they just pointed to. You didn't have the dental history beforehand with that specific question, and they didn't volunteer the information. But the problem is much worse than you think. When you now evaluate the patient and take a closer look at what they pointed to, you realize there's an open contact or a chip in a filling, broken marginal ridge. And now you have to tip them up and say, oh, Mr. Jones, you do need a new restoration on this tooth. In some ways, we think we've rectified the problem, we've gotten over the situation, but we really haven't. Because in the patient's mind, you really missed something. You really weren't the expert of their mouth. They were. In other words, they were able to tell you something about their own oral health that you didn't know. And from now on, they actually control you because they become the expert of their mouth. That's what I meant by saving the dentist's integrity.
all right, so that's basically, again, Dr. Kois just going over again the importance of those questions and how important it is to know this kind of information before you actually skip that section. And that's what basically those alerts are for. Those smart alerts will pop up throughout all the clinical modules, from the TMJ, the head and neck, the different sections and the tooth structure as well exam. It will always pop up and remind you of the concerns the patient have answered yes to throughout the medical and the dental questionnaire. So again, you're saying them out loud in front of the patient understands that you're actually taking their comments seriously. You make sure nothing is missed out, and obviously as well it helps guide you and make sure that everything is covered and you don't miss anything, and you don't have to ask the same questions for the patient over again and again, especially if they already have answered them for you, and again they've taken that time to actually write all that information in their forms. This is a short video just of Dr. Quist going through the exam. I think it's just a very quick video. I have 2 videos consecutively of Dr. Quist doing the TMJ exam and then the tooth structure exam, just to show you how it would flow. Again, you'll go over this exam with Nika tomorrow, and you'll see how it's going to be actually used. But this is just a very short video of Dr. Quist.
Moving to the TMJ exam, maximum opening,
Molly, if you can open as wide as you can, 51 minutes.
horizontal movement,
Molly, I'd like you to just move your lower jaw to the left side. Okay? Move. Now move it to the right side.
deviation upon opening,
Close. And open. Close. Open. No deviation.
tender muscle,
Any tenderness on the muscles in your face at all?
none. Immobilization test,
Molly, I'd like you to close your teeth together. Stay closed. But still try to move your jaw, but don't open. Do you feel any tenderness?
none.
Negative.
Moving to the joint evaluation, joint sounds,
Open and close. Close. Open. No joint sounds.
load test,
I'd like you to bite on the cotton holes. Close down for me. And I'm going to push on each side if you feel any discomfort. I'm going to push pretty hard. Anything uncomfortable?
No.
Maybe one of my fingers. But nothing right here, right?
nothing.
Okay, and then on the other side. Any discomfort at all?
None.
Load test negative.
So that's just Dr. Kois doing the TMJ exam very quickly, and how the assistant is charting live as he's basically doing the evaluations. So that's one of the exams that you will see tomorrow with Nika. And this is the tooth structure exam, just so that you can see as well how the assistant is going to be going through the evaluation with Dr. Kois. And we'll talk about this a bit once the video is over.
Moving to the tooth structure exam, any coronal cavitation,
Molly, I'm going to look at the tops of the teeth for any cracks, any holes, any defective fillings that I may want to remove. Actually, it looks like you have
radicular cavitation,
looking at the root surfaces, Molly, defects along the root surfaces. The outside and the inside. No.
any restoration,
There's an MO composite on 18, a DO on 19, a DO on 20, a DO on 29, a DO on 30, and an MO on 31.
isthmus width,
Isthmus width on 18 is a quarter, on 19 is a third, on 20 is a quarter, on 29 is a quarter, on 30 is a third, and 31 is a quarter.
any concerns,
There's a marginal opening on the mesial of 18 and the distal of 19.
tooth wear, matching or unmatching,
Molly, if you could bring your front teeth together right on the edges. Move them around a little bit. Close on your back teeth. Move all around if you can. Just move your jaw around. Move forward and back. Okay, open for me. I would say there is some wear on the teeth, and it's not matching. It's 1 millimeter, 23 through 26. 1 millimeter on 8, 1 millimeter on 9.
Any cervical wear?
No, there's no cervical wear.
Any pulpal concerns or fractures?
No. Well, they close together. Where were you concerned about the chips on the teeth specifically?
At the front.
So they're the lower ones that I saw with some missing parts of the teeth. That what you meant?
Yes, and then there's a chip here, and it looks like a crack.
Okay, the little crack line that appears to be
Yes,
right up there.
that,
Mhm.
and then the chip at the base.
So there is a slight little chip there.
Uh-huh.
We'll talk about that.
So that's Dr. Kois just going through the exam. And as you noticed, probably that especially with the tooth structure, it's actually the assistant that's guiding the doctor throughout the evaluation. And it is up to, again, it's up to the office to decide on what flow works for you. But it really helps, again, both pace the doctor so that he's not way ahead of the assistant. At the same time, it helps guide the doctor at what he's supposed to be looking at. So instead of it being just random upper lower teeth, existing restorations of different sorts, so instead of it being just completely random flow, it actually helps the doctor focus on a particular condition at a particular section of the teeth, and it helps the assistant chart things more systematically. So when the assistant asks, are there any existing restorations, indirect fillings, she knows that she's not going to be jumping around the crown, she's not going to be jumping around the wear. She knows that she's going to be focused on those few icons up here that are probably going to be composites, amalgams, and probably some gold fillings if the patient is basically old enough to actually have them. So the idea is that a lot of the times the doctor is basically is in that moment. He's actually just doing the comprehensive evaluation. He's not really aware of the speed that he's going at. Sometimes the assistant is not having enough time to actually chart everything on the spot. So it really helps pace out the exam properly. And I think one of the best as well, I guess, benefits of this is really the patient hearing out loud all those conditions being looked at. And although I'm sure everyone does a very comprehensive evaluation, but the fact that the patient never actually heard it out loud, it really makes it really, like, the patient basically really never knows how much you're looking at. So for all the patient cares is that you're actually just staring into their mouth for 10 minutes, and then they're ending up with a treatment plan of a few $1,000s. They don't really understand what you're actually looking at and how many things you're actually charting, how many things you're actually evaluating. So it really gives a patient a very good idea of what this exam actually entitles. So when you say you're doing a comprehensive evaluation, the patient actually understands the importance and the how detailed and how extensive that evaluation was. And it really as well brings up a lot of basically questions from the patient. When you say, for example, I don't know, there's wear on the front teeth, the patient is like, what do you mean wear? I heard you say that I have wear on my teeth. Is it that small thing here? So it really opens up a window of conversation with the patient. It allows the patient to understand a bit better what you're actually looking at. And again, just gives the patient the extra appreciation for what you're doing, and they understand how much you're actually putting in as effort and how much basically you're actually charting, because again, a patient has never heard it out loud, so they don't really know what you're looking at until actually they hear it from the assistant, or even if the doctor is saying them out loud. But definitely the assistant would be a great way to, again, guide the doctor and as well have the patient appreciate that comprehensive valuation, and they would actually be much more accepting again for the of the treatment plan when they actually hear that you actually took that time to look at so many different things. You've taken a full-on view, a global view of their entire dental health, and what you've decided as a treatment plan is not just a random on the spot kind of treatment plan, but it's actually due to a very comprehensive overview of the entire patient dental history. So it's really nice to have that flow in the office. And again, it's really important to help with, especially with charting for especially new offices that are using the system, to help pace the doctor and the assistant and help organize both of them so that they're charting at a speed that makes sense for both, and not having to end up recharting all of that because you had to write them on a paper and a pen because you're not having enough time to do it. Another thing that's really nice about this is the visual mapping on the odontogram, and a lot of the different conditions, a lot of different treatment plans obviously are visually represented on that odontogram. So that way, when you're taking a look at this chart, you actually have a very good idea of which teeth are going to be probably more problematic than other. So for example, in this case, tooth number 31 already has a large filling and there is a root canal on it that is already done. So you can see the difference as well in sizes. And that's something that you will see on the actual software, is that you have different sizes of fillings that you can actually chart, which on the system are called the isthmus width. And the isthmus width would actually vary as you chart it. So by default, it's going to chart to the small one, so the quarter, and then you have 1/3 and then above 1/3. So that way you can actually see the size of that filling on the surface of that tooth. So when you're looking at the odontogram, you can very quickly, by just skimming that chart, you can very quickly tell which one of those fillings are probably going to be your highest priority. So that way you can tell which one of those teeth are going to be a higher risk when it comes to the structural compromise due to that extra large filling that's on the tooth. So you do have, just to show you this again, when you're on the existing restorations, you do have the isthmus width in here that you can chart the different sizes, and then depending on the size that you chart, it will actually display the filling on the tooth occlusal surface differently, so you will be able to tell the size of that filling. So that is very nice when it comes to at least looking at the odontogram, to be able to tell again the risk of every tooth as you go through it. Same thing applies as well to your dentofacial analysis, which is your smile characteristics. So you do have different options as you're going through the exam to either say that analysis is not required if the patient is not interested, or you're not interested in doing a smile characteristics analysis. You can just click the analysis not required. You can say analysis required, data is collected, or further data is required, and then based on the images that you take. So for example, with Dr. Kois, he usually takes a whole series of pictures with the glasses that help with the alignment and all of the analysis of the smile. And then if you say analysis required later, it basically reminds you that you need to do it at a later stage. So that leaves, for example, the risk assessment is associated with that section, specifically the smile characteristics, grayed out until the analysis is actually inputted into the system. So based on all the information that we talked about, so you have the dental history, you have the comprehensive charting that we talked about, and all the ancillary documentations, the pictures, the photos that you actually collect. All of that will create a diagnostic profile for the patient that will help you analyze the diagnostic opinion and the risks associated with every one of those teeth. So again, for example, tooth number 30 that has a large filling versus tooth number 31, sorry, large filling, 30 has a medium and a small filling, including the history that the patient said yes to food being caught between their teeth. You can see the pictures that are associated with it, and then basically that all of it combined will actually lead to the risk assessment that the system will be automatically generating. So based on Dr. Kois's evidence and the information and the risk that he's been collecting and he's been working on for so many years, the system will automatically generate the risk assessment that you can see on the right side that, for example, in this case, will specifically on the tooth structure of those 3 teeth that we were talking about. So that 31 occlusal that had that large restoration is automatically a high-risk structural compromise versus tooth number 21 that had the small filling is automatically a low risk when it comes to a structural compromise of the tooth. So you can see automatically the system will generate those risks. So when you're reviewing the diagnostic opinion and the diagnostic profile of this patient, you'll be able to tell which teeth will be a higher priority for you to take care of before the others. Same thing applies to, for example, the AP classification or the perio classification, which is now the staging and the grading on the system. It is going to be directly linked to the horizontal bone loss, for example, on the patient. So that way, for example, in this case, when you say horizontal bone loss, the generalized horizontal bone loss is less than 2 millimeters, the system automatically will go for a mild basically AAP or the new staging, again, that is implemented in the system. So that way you will see that automatically the perio classifications will be triggered from the exam. And as we said earlier, the tooth structure will be automatically, for example, the structural compromise will be triggered based on the fillings that we've entered previously. So all of the diagnostic opinion, again, that you're seeing in here is going to be triggered based on all the different conditions that you've charted in the exam, and it will trigger those risks that are available for you on the spot, real time. The system generates them. So as soon as you're done with the exam, you can go into diagnostic opinion, you can review those, especially for a new patient, especially for a patient that is a complicated case that you want to sit down and actually brainstorm that treatment plan that would actually work for this patient. The diagnostic opinion would be a great tool to review, to use, to take a good global idea, again, of every single one of the 4 main categories. Again, the perio, the biomechanical, the functional, and the dentofacial exam. So that way you have a very good idea of what each one of those 4 categories have as risks, what problems are going to be your main concerns, what are important things that are actually being triggered. And one of the really nice things as well, even in diagnostic opinion, you can see the DH here that stands for dental history. So you will be able to see any questions that are coming from the medical or the dental history forms as you're reviewing diagnostic opinion as well. And the small eye icon as well that you see next to every one of the diagnostic items will allow you to actually read or actually see the literature that is linked to those specific diagnostic items. What is it linked to? Where is it coming from? So it really helps you better understand the diagnostic opinion with all those eye icons that you see in here that give you additional information related to diagnostic opinion line by line, so you can actually at any point, if you're reviewing something and you just need a very quick reminder on the spot, what is it related to, where is it coming from, how is it different, for example, how is attrition different than abfraction, you actually, if you just click on that eye icon, it will actually give you that short literature coming from Dr. Kois's work and actually Dr. Kois's forms. It will actually explain to you every single one of those diagnostic items as you go through. And what really is so great about this is that it actually helps you create a system for your clinical and treatment planning outcomes. And one of the really nice ways of how a lot of our offices actually are utilizing this is that, especially when you have if you have multiple associates, or even if there's only one provider in the system, what really this helps you is to actually create a system of how you want to treatment plan. So for example, this is one of the, I think, the easiest and the most common examples that a lot of our offices are using this, is that every single time they have a structural compromise that is high risk, so anything that goes under the red category under structural compromise is automatically treatment planned as, for example, a major restoration. So that way, regardless of who's treatment planning, regardless of the patient, regardless again of the day, regardless of what you're actually how your day has been going, you actually will end up treatment planning systematically the same exact, approach to the same exact diagnostic items. Because if you have it as a system that every single structural compromise that is high risk will never be a basic restoration, it will always be, or at least the main, at least, treatment plan that you want to suggest to the patient, and your priority is always going to go for a major restoration. That way the patient is aware that even though they might not be able to maybe afford a major restoration, or they're, I don't know, scared of doing, let's say, a crown, whatever the reason is, but once you actually look at a structural compromise and you see it as a high risk, you would suggest automatically a major restoration for the patient. And then if you do decide to go ahead and suggest a basic restoration, a filling or a composite for a high structural compromise, you can at least be able to tell the patient very objectively and very scientifically that there is a structural compromise, high risk, based on these few factors. And by going for a basic restoration, you're risking your tooth, basically, you're risking the structure of it, you're risking it basically fracturing. So that way, again, you're not just selling a treatment to the patient, but you're actually backing your treatment with an evidence-based diagnostic opinion that is good for the patient to understand, and as well it protects the office from, again, any kind of liability, because you are explaining to the patient the importance of the treatment plan that you're actually suggesting versus what they're actually going to go for. And it's very nice. And again, in a second I'll show you the video of Dr. Kois going and explaining the two different ways of how to explain to the patient and how to present the different treatment plans based on this diagnostic opinion. But again, it's very important to look at the diagnostic opinion, because it is, again, automatically generated. There's nothing that you're doing really, and there's no extra steps to generate this risk, but it actually gives you a very nice overview of the patient health, and that will really help hopefully guide you through the treatment planning phase once you get to that. So this is Dr. Kois, and I'll let you watch this.
I am sure we can all relate to a dilemma that we face every day in practice that I call large composite versus the crown. It's also a minimally invasive. As you take a look at the molar on the screen, I'm sure you would agree that if you replace that composite, that would be considered a minimally invasive restoration. The problem is when you also see the decay on the distal, the composite gets larger, it also results in a weakened occlusal surface of the natural tooth. If then subsequently the patient breaks that tooth, cracks that tooth, and now renders it non-restorable, then that is seemingly a minimally invasive composite was not actually minimally invasive. So now here comes the dilemma. As you look at the same clinical situation, most dentists would say something like this to the patient, as I would. Mr. Jones, you need a crown on this tooth. Molar. I don't think any of us have a problem in the logic, and either with the patient once you made an adequate explanation. The problem is not encountered until they now go to the front desk and find out the cost of the crown versus some other type of restoration, especially components. Now they come back to you and they're very concerned because maybe the crown won't be covered by insurance. Maybe it's not even affordable. And the reality is the composite is maybe 5 times cheaper, even more. And so now they have a bigger problem. You turn around and tell them that you would be willing to do the composite after all. They face a different problem. Because now they realize they can't afford the crown, which isn't good. But they also now may think you tried to upsell them in the first place because you'd be willing to do the composite, but you told them they needed a crown. And when you use the word need, you have to be prepared to defend it to the death. And we start playing tennis with patients. We say something, we say something back. Let me provide you a better verbal skill. Provide ethical treatment to patients based on evidence-based principles that make a lot more sense. It would go like this. Mr. Jones, this particular tooth needs a new restoration. You have two choices. I could provide for you a tooth-colored restoration that would adequately seal the tooth. But the problem, Mr. Jones, is sealing the tooth may not be enough, because the restoration will be quite large and the tooth would be weak, or certainly weaker, and you may break it. So, Mr. Jones, we have another type of restoration that both seals and protects the tooth. That requires an indirect restoration made by a laboratory. In fact, we make that one out of porcelain. My recommendation for you is that type of restoration, to both seal and protect. And that's what I would do for my own mouth or for any other person. And the reason that I would present it as two choices, one to seal, direct contact, one that seals and protects, indirect restoration, is they can understand the choices, and if something happens where the tooth actually breaks after the composite, they don't blame you. They come back instead and they tell you, you know, doctor, you warned me, you told me, you informed me, I should have done it. And that's the way I would prefer any of those unwarranted situations in a positive way, because we tried to do the best informed consent, tried to do the best recommendation for our patients, even though it wasn't an option in that particular situation. You can't go wrong always giving the patient options, but always making sure they understand their choices and what the liabilities are. That's my recommendation for this clinical tip, and it will be the basis of how the software represents emotions.
So this is how Dr. Kois would present the two different treatment plan options. And again, based on the diagnosis that the system has generated, you can actually present those different treatment plans and at the same time explain to the patient the importance and why you decided that that major restoration is actually the best option for the patient. And the problem really is in this case is that you need to have the right tools to explain to the patient that risk, and you really need to have the right methods and the right visuals to explain to the patient what is the main problem and how is it important, and for them to feel more personally attached to what you're saying and not just a random bunch of terms that they don't understand. So, and that's where actually that entire clinical module feeds into when it comes to how we've tied it all together, is basically taking it back to that risk assessment. So the risk assessment is going to be a report that the system will automatically generate based on diagnostic opinion. So all the data collected that you have inputted into your exam, all the details, all that comprehensive documentation, all of that feeds into that diagnostic opinion, and that diagnostic profile that's been created for the patient on the system is really useless for the patient if he cannot understand it. So what we've done is we've worked really hard with actually Sandy Roth, and she's been helping us. She's an amazing psychologist with so much background in the dental field. She's helped us with writing and rewording all that diagnostic opinion and all those diagnostic items into more patient-friendly terms. And we'll go over this together in a second, but the idea is to basically translate that big, large those large terminologies, those large words, those big scary jargon words that the patient probably will not understand, into something that the patient can actually relate to and can easily understand. They can actually look at, they can read on their own and still actually make sense of it. And hopefully that will give the patient those tools that they need to better understand their case, and gives the office the right tools to explain to the patient the importance of that treatment plan that you're suggesting, and how it's actually going to be, or where is it actually coming from, why is it important, what are the risks of it, versus anything else. So what you're looking at on the screen right now is actually on the left side. This is the wheel coming from the dental history. So there are 4 sections on that wheel, versus what you're seeing on the right side here are actually the 4 sections divided into 2 subcategories each that are coming from the diagnostic opinion. So the gum health, which is the perio, is divided into gum and bone. The tooth health, which is the tooth structure, is broken down into weak or broken teeth and the decay. The bite and jaw joint is coming from your functional exams, the TMJ exam, and the wear. So it breaks down into bite and jaw joint and the tooth wear and mobility due to the functional reasons. And then last but not least would be the smile, which is based on the dentofacial exam, and which is divided into the color and alignment versus the gum display. And each one of those 8 categories will have a risk associated with them. So you can see there is a color on every single one of those categories. It associates with the risks that are linked to those particular categories. The icons will show based on what is actually problematic. So the icons will change as well. The teeth inside here are a great reference for the patient, first of all, to understand when you say tooth number 2, they understand what you're talking about. And as well, it obviously will show them their own missing teeth. So that way the patient has a very good reference to when you go into the second level of information, the patient can actually refer to this chart as we're talking about this. So the first one is what the patient starts their journey with, and that is basically the end of that comprehensive evaluation that they take back, hopefully with them home, and with something that will be easy for them to understand. So this is the first page, and this is what it's going to look like. So it's going to have the wheel, but the main thing that is on this page is actually the main concern. The main concern of the patient, this is actually coming from the dental history. When the patient fills in their dental history forms, the first question the system asks them is, what is your main concern? Why are you visiting the office? What is the main issue that you're actually worried about that actually is causing you to take that appointment and to go to that office? And the reason why the system will print out the main concern on that front page right above the wheel is to make sure that the patient understands that the office actually understands and takes the patient's main concern seriously. This is the main thing that they will be looking at, and that is very important for the office. However, right under it is the wheel that will indicate to the patient what the office found as high risk. So although the main concern, for example, in this case is staining due to coffee and small chips, but if the patient actually has much more serious problems when it comes to their perio health, when they have a lot of decay, so it will be a nice way to explain to the patient that although this is your main concern, we understand that this is what's going to be driving us. However, based on the evaluation, the comprehensive evaluation that the doctor did, these are the few areas that we found that are of high risk, that are worth looking at before that main concern. Or maybe that main concern actually is the same exact concern that you end up with after your comp exam. And you can tell the patient that your main concern is actually our main concern. It's actually the same exact problem that the doctor has found after the comprehensive evaluation, and that will be our main focus on the treatment plan. So it's really nice for the patient to understand that that main concern that they mentioned in those forms is not ignored, is not just a random sentence that they just had to type in and no one looked at, but it's actually something that is very important for the office and that you did not forget, and you're actually taking it seriously as you're thinking and discussing the treatment plan going forward. The second level of information right after that wheel is actually the patient's personal data. So the second level would be divided between findings list. So it's basically going to be the clinical findings that you've charted throughout the exam, but all the terminology that you will see here are actually reworded from the diagnostic items into something that is much more patient friendly. And right under it, you will see all the pictures, x-rays that you've taken of the patient, and that will never be placeholder images. This gives the patient a very personal risk assessment that they can actually look at, and they will understand what you're talking about. So when you tell them that you have some chips here, let's say you have very, very strong wear on the front teeth, this is, for example, I don't know, a spot that we're concerned about, you actually are showing the patient his personal teeth, his own x-rays, his own photos. So when you're actually talking about that, about their case, they're not just looking at those random placeholder images that really relate to him in no shape or form, but they're actually very personal experience. They're looking at their own pictures, at their own images, and that way not only is it just they understand what you're talking about because you can actually refer to that specific tooth, but as well it creates this emotional experience with the patient, that he will see what you're talking about. He understands that small or that large fracture, that filling that they have in the back of their mouth that they never probably saw fully, and now they actually are actually seeing it fully on a full colored photo printed out in front of them. That creates a bit of that emotional kind of connection to the case, and they would actually understand better what you're talking about, and they'd be more devoted to actually going ahead with the treatment plan because they can actually understand what you're talking about and they can see what you saw. And then the third level of information that is available as well is the full explanation of this of those 4 sections. So it will start with an explanation of what, let's say, gum health is, or what bite jaw is. So it explains a bit what that is, and it's divided into 3 basically risk-oriented categories or groups. So it will start always with a positive. It will start with what the patient is doing great, if they're taking great care of their teeth, there is no tooth wear. It just basically is an encouragement for the patient to understand that there are things that they're doing very well, they're taking care of, let's say, their hygiene. So it's really nice to start off with an encouragement. Then it goes into the moderate and then the high risk. So the high risk and the moderate risk is basically a paragraph of explanation or literature that the patient can read. Again, very lightly written, very patient-friendly terms that the patient can understand how many areas of concern there are, what could be the focus, what could be the main issue if they don't actually go ahead with the treatment. It never actually suggests a treatment for the patient. Sorry. So it never really actually suggests a treatment for the patient. It actually just explains to the patient what the risk is and what could be the future risk if they don't go ahead with that treatment that you're going to suggest. So it just puts the patient in a mindset that they actually have a good reference that what could go wrong basically if they don't go ahead with the treatment that the office is actually suggesting to them. And last section on the actual risk assessment is going to be the medical factors. And I think this is one of the office's best or favorite sections to that risk assessment. Is it actually ties as well that medical history that the patient has filled out to that final dental health evaluation. And that's something that a lot of patients miss, and they a lot of times forget that their medical basically health and their dental health are not isolated. They're not separate systems. They're the same exact system, and both will affect each other. And a lot of times these things are not mentioned. So it's a very nice way that the system brings all those medical factors that could be affecting the patient's dental health and mentioning them at the end of that report. So that way, first of all, the patient is aware of their medical conditions that could be affecting their teeth. And as well, it really is kind of a chance for the office to bring up some of the topics that maybe some patients feel sensitive about, or they don't know how to approach as subject or as a topic. So it's really this kind of objective scientific look at what could be affecting the patient's dental health, and that way the office can approach it more of, so this report is mentioning that you have, for example, I don't know, whatever, allergies, you have some previous medication that you've been taking. So it really allows the office to kind of bring up some of those, maybe some sensitive topics up as part of that risk assessment review, so that the patient understands that these are really part of their of their dental health. So the report will basically end with the different, so you can actually print them out as a package, or you can send them out electronically as well. So this would be something that you would actually hand out to your new patients after a comprehensive evaluation. It will have all the different pages. It goes over everything. It has your office logo with your information. So it is a very nice walkout packet for the patients to actually have when they finish their first appointment. A lot of our offices print out this walkout packet, this risk assessment. They put them in a folder with the brand, basically the logo of the office, with the information, with their appointment card if they need to. So the patient actually leaves the office with a nice packet for a new patient. So that way, it is a very nice, again, kind of ending to a new patient visit. And as well, it's a very nice referral tool that we've had a lot of our offices actually tell us that a lot of the patients, when they take this packet home, when they show this risk assessment to their family, friends, it creates an interest and creates a nice, again, interest of the patient into the office, and they actually would like to come in and they would like to have this kind of comprehensive evaluation to go over. Moving on from here, so the risk assessment is part of, again, the walkout packet. Another part of that walkout packet is going to be the concerns and the home care list. So the concerns are automatically triggered by the system, which comes out based on the conditions that you chart on the exam. So if the patient said yes to any TMJ problems, if you have any previous dental works, it creates a list of concerns or FAQs that the patient can have access to. So it answers any kind of concerns or problems or questions they may have regarding those conditions that you've actually charted. And then on the right side, you can see the home care instructions, which is linked directly to the adjunctive therapy page that you will see tomorrow in details with Nika as she goes through the clinical module. And it will automatically generate based on what you've recommended versus what the patient is using. So that way, it will create this printout that you can print out for the patient, give it to them instead of having to write those products on a post-it. And what's really nice about it is that the RDA, the abrasive index of the toothpaste, it's built in. Same applies to the pH of all the oral rinses. It's already built into the software. So when you're printing out the home care, not only are you recommending a brand or a product, but as well, you're actually giving a patient very nice educational tool to understand why you're actually recommending this product and nothing else. So just very quickly to go over this together. So the benefits of using the Oryx Evaluation module is the clinical module is obviously standardized and expedited. There's a guided risk-centered treatment planning. So as you're treatment planning, you will see all the different risks, the diagnosis that has been generated. So that really helps with driving the treatment plan based on the risk of the patient. There's less liability because of the exposure of the documentations that you have, that we'll see in a second. So you have access to a lot of the documentation, the literature, both in diagnostic opinion, as we saw earlier. You will see it through the protocols of all the procedures. So you have access to a lot of that documentation throughout Oryx. Obviously, it generates higher exam value for the patients because, again, as we said, it actually explains to the patient the importance and how comprehensive that evaluation is, and hopefully that will lead to more patient acceptance cases. And then obviously at the end of the day, it is a patient-centered approach, hopefully that will improve the practice culture and will improve the way a patient journey and experience is in an office. So moving into the treatment planning module and going into a bit more of the second part of the clinical section, starting with, first of all, the odontogram treatment plan. So this is just kind of visual reference to all our users right now, which I'm sure the people that are using the software actually are familiar with this already. So anything that is existing outside the office would show up as blue. Anything that is referred out as purple. Treatment planned and not yet done. So basically this is treatment planned on the patient, that will be in red. And once it's completed, it will be in black, which is really nice because if a patient ever calls you and they're like, oh, your crown broke, you can just simply open up the odontogram and very quickly check if that crown is completed in the office versus what's existing outside the office. So that way it will really help you tell what's been already done, what's treatment planned, and what's been already done outside the office previously. So very easy, hopefully at least visual key for you. And then one of the really big parts of the treatment planning is actually the power codes that are built into the software. And this is just a short video of how the power codes work. So the power codes are what some softwares called exploding codes. So for example, we have a built-in code for the endo build-up crown code. So by just simply clicking on that one icon, you will see that it automatically adds the root canal treatment, the core build-up, the crown, and the delivery. And you can see here actually that there is a prep and delivery automatically added in. And that's really one of the really nice things about the treatment planning module, is that the treatment, when you treatment plan a major restoration or any procedure that requires a lab, it will automatically add a delivery associated with the prep. So that way you don't add those custom codes, those random codes that you've created in the system that are not related or not linked to any specific code, not related to any tooth. The way the system adds that delivery code is that you can actually track the delivery of which tooth, of which crown. You can add as many follow-ups as you need to. So if you're doing an ortho case, if you're doing, let's say, dentures, you can actually add follow-ups, adjustments, wax-ups, so you can actually track that same procedure in its different stages, and it will automatically show up on your schedule, which gives you a very nice access, which I'll show you in a second, how the front can just simply schedule this very easily. And as well, it gives a very clear breakdown for the patients, so they can see how many visits are going to be part of that treatment plan, how many times they're going to be coming into the office, what's the duration. You can set a duration for every one of the visits. You can add a different note associated with every one of the visits. So it's a very organized way of treatment planning that will help you track your acceptance case hopefully much easier, and it will help you as well present those cases much easier. We do have a very nice upgrade that's coming up soon for the printouts of the treatment plan presentation that will be out hopefully very soon. It's in the testing phase, so you'll be seeing a new way or a new printout for the patients that is very flexible. The office can set it up in whichever way they like to show so many different numbers, different treatments. So you can actually present the patient with a very nice treatment plan printout. So that will be coming out soon. So so once you actually use the power codes that you see in here, so again, you click on the tooth, and then when you click on any of the power codes that are fully customizable by the office, you can add as many as you want to. You can customize them to what you need in the office. You can hide things that you don't do, so that way you can have that treatment plan fully customized to the needs of the office. And you can do very complicated treatment using those power codes. And especially that now you do have some time on your hands due to, unfortunately, the circumstances. I think that would be a great time to look into your power codes, to set up more power codes that you do very frequently. And I know there's a lot of times that those power codes and checklists like these are usually set aside for a later time when you actually have time on your hands. And I think now is a very good time to actually take that time to go into your treatment plans, look at the power codes that you have already on the system, what's missing, what combination of procedures you regularly do in the office that you have to do multiple clicks for, you have to manually add the codes that are not easily accessible for you, anything that you feel like you need to add to your treatment as shortcuts, definitely take the time to do that. I think that will simplify so much your life, and it will take away so much of the complexity of treatment planning, procedures or treatments that require many procedures attached to each other that are frequently done anyway in the same order, in the same sequence, and on basically the same exact codes over and over again. So if you can create your own list of power codes, set them up. If you need any help with that as well, obviously reach out please to our support. They'll be more than happy to help you with that. But make sure that you have all those power codes prepared for you, so that way you can actually utilize them, and again, just hopefully simplify the treatment planning process for you. So just a very quick view of how things would look like. So for example, again, root canal, the endo build-up crown will add the root canal, the core build-up, the crown prep, and the delivery. And you can see you can rename the visit. So you can say root canal treatment, you can say crown impression, crown seating, and then you can say that there's 90 minutes, 30 minutes with 60 minutes, for example. There's going to be a total per visit, a total per phase as well, and then a total for the entire treatment plan. So you can actually print out a detailed breakdown for the patient, that they can understand how much each visit is going to cost, how much it's going to take time, how many visits it's going to require to actually finish that treatment plan, so they can better prepare, obviously, for financially, and as well to be ready when it comes to their schedule as well, to how many times they're going to have to empty out, maybe how many days they're going to have to take off their work, and so on and so forth. So all of that is customizable again from your admin side. You can add as many codes associated to the same power code as you need to. They can be divided into multiple visits, multiple phases, so automatically they'll be spread out into different appointments instead of having to manually move those codes into different appointments every single time. So it's really worth investing some time into creating those power codes to simplify your treatment planning process. Another really nice thing on the treatment plan is the different procedure statuses that are available, and they're really important to use for you to have a very nice metric of how well the office is doing when it comes to the patient acceptance cases. So these are all the statuses available. So you have diagnosed. So diagnosed, again, is for treatment planned procedures. So these are procedures that were planned but have not been presented. The patient is not aware of them yet. And this is something that happens not very frequently, but it does happen if you're treatment planning a very complicated case and you really don't want to do it very quickly on the spot. You want to take your time to treatment plan it. So you diagnose all those procedures, and then you want to schedule the patient for their consultation appointment to actually present it. So the second stage would be presented. So you present that case to the patient and you're still waiting on a response. So that would be presented. Then you have accepted, which obviously means the patient said yes to. Rejected is for anything the patient has explicitly said, no, I don't want to do it. And it's very nice to use to actually be able to track the rejected procedures, because instead of it just instead of first of all deleting it, which is really bad for documentation purposes, because if you do suggest a procedure for a patient and they say no, so for example, let's say, I don't know, fluoride, whitening, any procedure the patient says, no, I don't want to ever do this procedure, I'm too scared, I'm not interested in it, financially I can't afford it. Any kind of rejection that is a flat out no would be a procedure that you want to mark as rejected. You can actually track it in your potential acceptance rate, and that's the wheel that you see on the right side, which we'll talk in a second about, but it would be a nice way to track the potential loss due to rejection. And as well, it's a very nice documentation for the future. It gets automatically removed from the treatment plan procedure list, so it's not in your face and always jamming up your view. It gets automatically hidden in a separate section, but at the same time, it will be available for you to review, so you can tell the patient, actually, we did suggest this, let's say in 2018, and you said you don't want to do it because you're scared, or for example, you don't have the time, it's not your priority. You actually have a list of reasons that you can actually set up, so you can actually select why the patient has rejected the procedure. The future and the follow-up, although they sound similar, they're actually very different. The future is similar, it's closer actually to the rejected list. So future is something that would probably never happen. Patients is like, you know what, maybe I'll do it once my kids graduate from college, and his kids are probably like 5 years old. So it's going to happen probably like 20 years from now, which probably means that they're never going to happen, but it's not really a flat out rejection. So it's really nice to be able to separate them from the rejected list, and they're not actually intended to be followed up with. So the follow-up list is a list that you actually want to actively follow up on. You have a date that you can set up when the follow-up is going to come up, and you can actually generate that list of procedures that require to be followed up based on the date. So you can actually have someone follow up on those procedures at a later stage. So that way, those procedures are something like patient is traveling for 2 weeks, they'll get back to you about it, or you know what, let me talk to my partner, and I'll get back to you in, let's say, a month from now or in 2 days from now. So that way you can actually move those procedures to a follow-up list. So that way, when you're actually looking at your reports, you can actually generate a list of all those patients that require to be followed up with. So that way you don't lose that potential from the office. And then the last two are existing in office and existing out of office. Those two statuses are used particularly for the conversion. So when you convert over from a previous or from an older software, the existing in office are procedures that were done in the office, versus out of office are procedures basically that were added into the software from a different office as well. So these are particularly used for conversions. All those procedures are coming up from, they show up basically in your acceptance rate that you see in here. And this is part of your dashboards. So it will allow you to track all the acceptance and the rejection of the treatment plan. So that way, when you're looking at the metrics of the office, how well patients are accepting their cases, how many are rejecting the cases. So that way you actually have a very good number that you're looking at, and your consultants can actually look at the numbers and tell you where the potential is being lost, how to better communicate maybe with the patients, which patients need to be maybe followed up with. And what's really important and what's really nice about this is that the way the treatment plan system is built is that you actually have not only different phases and visits, but as well you have different treatment plans. And different treatment plans allow you to create alternative treatment plans for the patient instead of having them all dumped into the same treatment plan. And what really this helps with is actually keeping your acceptance rate accurate. Because if you have, let's say, 3 different alternatives all in the same treatment plan, they all will show up as a potential for the patient acceptance rate report. And that way you will show up as if you have, let's say, thousands of dollars on every patient that are pending to be accepted, or they're all accepted but they're not actually being done. In reality, actually, 2/3 of those procedures are actually just alternative procedures. For example, so one of them is an extraction implant, one of them is a crown, and one of them, for example, is an onlay. So those 3 procedures, instead of them being all in the same treatment plan, you would actually have them as alternative treatment plans on the patient's profile. So when you actually activate one of them, it only runs the acceptance rate based on that one alternative treatment plan instead of all the different treatment plans. So that way, again, when you're looking at your acceptance case, you actually are looking at much more accurate numbers, and you can actually learn where the potential is being lost or what might need better follow-up, instead of actually looking at numbers that are probably going to be jammed up with alternative procedures from different treatment plans. So this is really nice to keep in mind as you're treatment planning. Definitely utilize your multiple treatment plan options on your treatment plan page, so that way you don't actually end up treatment planning all alternatives in the same treatment plan. So on the right side here, again, you do have the pending or the follow-ups, you have the rejected, you have the diagnosed and presented, and you do have the accepted as well. The accepted are divided between accepted in progress, so basically an accepted and schedule. So accepted and schedule are all the procedures that already are linked to appointments on the schedule. So these are procedures that are already potential production that are scheduled, versus accepted in progress. This is going to be a list of procedures that are remaining on the patients that are already scheduled. Meaning that, for example, in this case, so for example, I have a root canal treatment, core buildup, and the crown. So if I go ahead and I schedule the first visit, this will be accepted scheduled, versus the rest of those procedures are going to be accepted in progress. So these are split automatically aside, so that way you don't actually reach out to those patients because they already have at least one appointment scheduled in the future. Versus the accepted not scheduled is going to be definitely the list that you want to reach out to, because those are patients that have actually accepted your treatment and they have not scheduled yet a single appointment in the future for their treatment. So this is really nice to look at, and as well, we'll get to it once we get to the dashboard. You'll be able to generate a list of the patients related to this pie chart as well. So we'll get to that at a later stage. So speaking again of risk assessment and risk-centered treatment planning, so the different perio grading and perio charting, perio classifications will generate automatically a Recare plan or a hygiene plan for the patients based on what stage they are in when it comes to their perio classification. So for example, stage number 1 will automatically default to 6 months prophy, versus let's say stage 2 automatically will remove the prophy out of the Recare plan and actually add a perio maintenance as an option for the patient, versus stage 3 and 4, which is the highest risk, will automatically add a maintenance at 3 months, for example. So you will see that the system will actually encourage the different types of procedures based on the risks, which actually will feed into your hygiene or Recare plan that you will see on the patient's treatment plan page. So you will see the procedures that are due, you'll see the frequency, the system automatically will generate a due date for you. And based on the last due date, it will either be the procedure will either be overdue or it will be basically on time. And all of this will automatically trigger as well your Recare or your hygiene interval potential, which is basically your Recare report. And it will show you which patients are on time and which patients are late and why they're late. And this is actually very important as well to keep an eye out, and it really helps you track the reasons behind the patient's lateness. So you have the patients that are late with no appointments, meaning that they actually left the office with no appointment whatsoever linked to their Recare plan. So meaning that the patient actually never got an appointment for their hygiene. Versus patients that are late due to broken appointments, which means that the patient actually took an appointment that is a hygiene appointment and they just broke it. So they either canceled, didn't show up. So that way you know that if you have the majority of your patients that are late are due to broken appointments that you have, that means that maybe the patients are not getting enough reminders, they're missing the appointments, maybe they don't actually understand the importance of actually coming on time. So that's something that would be definitely handled differently than having most of your appointments late due to no appointments. So meaning that patients are leaving with no future appointments automatically on the schedule, which means that you probably want to encourage your front desk to make sure, or maybe your hygienist, to make sure that their treatment, they're actually scheduling that next Recare visit when they're actually, before they actually walk out the patient. So it really helps you track the reasons why your patients are late. And again, same as the pie chart before it, it will allow you to as well generate a list of all those patients that I'll show you in a second. And you'll be able to track all your communication with the patient and all your notes with that patient. So based on basically all that treatment plan that we talked about, the procedures that were added into a treatment plan, all of that will automatically generate the consent forms that we were mentioning earlier. And again, this is your iPad application or your tablet application that will give you access to not only, again, the medical dental history forms, the treatment plan, so the patient can actually sign it, but as well, you do have the consent forms that are automatically triggered based on what the treatment plan contains. So that way, if the patient is treatment planned for a porcelain crown, tooth whitening, fluoride, they will automatically pop up in here, so you don't have to actually worry about looking them up. And you can actually just hit that button at here at the bottom right corner, and it will open up the signature pad for the patient to just simply sign with their finger on the iPad application, and it will automatically sync with their chart on basically their on the Oryx account. So same thing as the iPhone application, it automatically syncs with the patient list. So you don't have to worry about adding patients or anything. You just simply look up the patient. It will show you the picture of the patient, their information, and all the forms that are required to be signed. So that way you don't have to worry about looking for the forms again in your drawer, trying to find those consent forms as from here. So once you actually sign this, again, it saves a copy of the signed consent form into the patient's additional documents. So this is really nice to know that you can actually always access the signed documents and you can always print them out from the patient's chart. So that's something that is really nice as well to give to the patient if they ever request it. So once you're done with the comprehensive evaluation, once you're done with the treatment planning, you would want to write your exam notes. So the comprehensive evaluation is something that you've already charted in the evaluation section on Oryx. And obviously you don't need to rewrite anything. So this is just a very simple way of how you would generate your notes. So when you click on generate exam notes, it will actually pull all the findings that you've charted in your exam into your clinical notes. So that way you don't actually have to type anything out. So you can see here, you have the two structure findings. So if there's any bone loss, any comp exams. So if you see there's the TMJ as well, the periodontal and the oral lesions, everything gets transferred over into your clinical exams. So you don't actually have to write any of that. And as probably already our expert users know that you do have a lot of different places where you can write notes as you're doing the evaluation. And again, you'll go over this with Nika tomorrow. And all of the notes that you write as you're actually doing the evaluation will get copied into the clinical notes at the bottom section as well. So that way you don't have to remember to type anything up at the last minute. So it's a really nice way to just write notes as things come up, and then automatically it will pull them all into that clinical note at the end of the day. Next is actually our procedure checklists and the progress notes. So these are the treatment notes. So the treatment notes are based on protocols that are coming from, again, Dr. Kois's procedure protocols. And those are actually come in two different forms. So you have the format that is the visual format that is great for office team members that are either new or temporary, that are not aware of maybe how the procedure is done, or maybe you want a very quick reminder of what tools need to be prepared, how the room needs to be prepped up, which material you're going to be using. This is a great reference to the procedure protocols that are available on your progress notes page. And the same exact content actually is triggered into those notes into the checklist. Those checklists are fully customizable, and that's another thing that would be a great opportunity to actually review and to customize for your office during this time that you actually have some extra time on your hands. Definitely go ahead into your checklist, go into the admin side, make sure that you have all the checklists that you need. So anything that you remember that you had to actually type it up every single time after a patient appointment, definitely make sure that you've added them into your progress notes, into that checklist that is available for you to generate automatically by just simply a click of a button, instead of having to type it up every single time. So this is a great time to actually review those checklists and update them to actually reduce all the manual labor that you have to put into every time you write a progress note. So I'm gonna basically, again, the idea of having those checklists is hopefully to standardize the outcome and to improve the quality assurance of the office. So you have a standard protocol that will allow all the providers to use the same exact steps. The practice allows them to assess the treatment based on the risk requirements. So based on the risk, you actually are treatment planning. So both, as we said, the hygiene, for example, like prophy, peri-maintenance, SRPs, and as we saw earlier with Dr. Kois's video as well, major versus basic restorations. So the treatment plan is basically triggered or driven by the risk of the patient. And then the practice can improve, obviously, the team member performance with all the educational material, as we said, all the different interpretation keys, the protocols are available, all of the diagnostic item explanations, all of that is really nice educational material that allows the entire team to be at the same page when it comes to the clinical side of it. So once you actually do, as we said earlier, those home care products, the adjunctive therapy that you will see tomorrow live on the system, as soon as those are inputted, that triggers automatically the purchases list for the office. So automatically they will show up as recommended products if these are items they actually sell in the system. So if you actually assign a price to those products, they will automatically pop up for you as you're walking out the patient that these are products that the back has recommended the patient purchases. So that way you can just simply hit that buy button. You can add a quantity if you want, if the patient is buying more than one. So that way, again, the back doesn't have to run to the front with a post-it or a routing slip to indicate to the front what products the patient will be requiring. So this is a very nice tool that you will see again in action tomorrow with Nika. And the other thing as well, obviously, once the clinical team actually marks the procedures as done in the back, it will automatically pop up for the front for them to be able to walk out and to collect the payment associated with those procedures. So everything that the back team is actually posting from the back, so anything that they're actually marking as completed, will automatically pop up on the billing side. So that way you can actually add an invoice and add a payment. So I'm just going to show you a very quick clip of the invoice. So you can see the invoice has been added. If you add a patient payment, it automatically shows up how much the value is, and you can just close it off. So I'm just going to slow this down very quickly. So again, you can see that there's an invoice. The invoice will be generated with the list of the procedures that you have completed as a clinical team. The front, if there is no insurance, you can actually just apply the patient payment. And you can see once you hit that patient payment, it will automatically pop up the patient amount, how much the patient owes the office. And that way you can just simply close off the invoice, so that way it shows those zero balances. Obviously, this is a very simple idea. There's a very simple scenario that you will cover actually much more in depth with Nika tomorrow, different scenarios, how to apply adjustments, how to apply insurance payments. You'll go over this, and your exercises tomorrow after the webinar will actually cover even more in-depth cases. So this is just a very quick overview for now. And something that we have released very recently is the patient online payments that actually allow the system, the office, to share with the patient their statement electronically. And that way the patient will receive an email saying that you have a new statement from your dental office. Once they click the view statement, it takes them to my chart. You will see all the open invoices, what's outstanding, and they can pay by card, or you can even actually open the bank transfer, which is the ACH payment with OpenEdge, and that will allow the patient to transfer direct money from their bank account to yours. So it's really up to you to either go to pay by card or to pay by bank transfer. So once the patient has an overview of their actual statement, so they can see it on the system, and then they can just click on card payment, and it will allow them to enter their actual card number, obviously their PIN code, and it will automatically add the payment on Oryx. So you don't have to worry about accepting, you don't have to worry about adding that payment into the system. It will automatically be entered into the patient's ledger. It will zero out any outstanding balance, and so on and so forth. So it will automatically get inputted, and you get notified on your end that there's a new online payment that was added on the system. So you're aware that there's a payment that was added to Oryx. So last small part that we're going to cover related to this is going to be, again, the idea of the drag and drop of the treatment plan. And that's something that is really nice, and it would be a great tool to utilize in the office altogether. So when you actually treatment plan into phases and visits, it gives the front desk the same view of those visits. So for example, in this case, the root canal, crown, and impression and seating is automatically popping up for the front to be able to schedule. So they know automatically that the root canal treatment, which was visit number 1, would require 90 minutes. Crown impression is going to be 70 minutes, and let's say the seating is going to be 30 minutes. So that way you can actually I'm just going to play this video. The front can actually just drag and drop that appointment, and it will automatically take up the length and the duration that is required. You can skip 1 week in advance, for example, and you want to do that crown impression. You just drag and drop that, let's say, into the major restorations spot, and it will take up 70 minutes. And then, for example, if you want another week before the seating is, you just drag and drop that extra last third visit, and it will take up that 30-minute block on the schedule. So it's really nice and it's really easy. So that way there's no need for routing slips. You don't need to explain. You don't need to run out with the patient to explain to the front what is actually treatment planned, how much time the doctor is going to need, and so on and so forth. So it really helps just reducing that amount of communication and mistakes that happen when treatment planning and actually creating those future appointments. So that way it takes really just a few seconds really to schedule those three visits in the future if they're actually treatment planned in a very organized manner using the power codes that I showed you earlier. So it really helps the front utilize that organized treatment plan and actually make sure that every single patient is leaving the office actually scheduled for the future, so that way you don't lose the potential of patients just because it was way too complicated and you just needed to call that patient afterwards. So it really helps just simplify the scheduling process for the front. Again, hopefully using the power codes will help you treatment plan easier, the treatment plan, the procedures, and that pushes forward to the front. And that is how hopefully the flow is working in your offices. And again, just creating this easier flow between the back and the front to minimize all that communication and all that mistakes that could happen, and the routing slips, again, that usually have to be written and passed along from the back to the front. So that is another thing that is really nice to utilize, and hopefully, again, you're using this to its optimal potential. I'm going to just show you quickly just the referral portal. I don't want to go into details because I think we're running out of time. The referral portal is available on the system. You have different ways of setting up. You have different templates that you can set up for your referral providers. So you can set up one for endo, one for surgery, one for maybe ortho, and you can actually have those templates and use the templates to fill more of the clinical information that you have here on the left side. And actually it will generate a letter that you can either print out or you can actually send electronically that goes towards the doctor's online referral portal. So that referral portal does not require the specialists to actually be Oryx users. It creates an account that's basically very similar to what MyChart is. So MyChart is the patient's portal to share information with the office. The referral portal is basically the specialist's portal to log in. Once you share electronically a case, they will get a link. They just log in and they will be able to see only the material that you actually shared with them. So that way you will be able to actually send them the letter, the diagnostic opinion, the history, the x-rays, the photos that you've taken. You can send those out and they can actually get them digitally, fully encrypted, HIPAA compliant. So you don't have to actually send by email any of those information anymore. Last would be your dashboard, and I just want to go over it very quickly with you. The dashboard is divided into 4 sections. The first section is actually the total production. So that's the first row that you'll see on the dashboard page, and it's divided between your total office, your dentist, and your hygienist production. So you can see that black vertical line will indicate your goal, which you can set up for every provider and hygienist, so every dentist and hygienist. And the system will calculate automatically how many hours each dentist is working for, or every hygienist, and it will actually set a goal for a daily goal, a monthly goal, a weekly goal, and a yearly goal for you. So that way you can actually set that up from the admin, and then this dashboard will be generated again on a daily basis, weekly, monthly, or yearly. It's real time, and that's one of the really nice perks of having a cloud system. It's automatically computed, it's always real time, it's always up to date. So every time you go to that dashboard page, you'll have those numbers in front of you, and as well you have access to them on the schedule, which Nika will cover next tomorrow. So the idea is that you will be able to see your production, So everything that's been posted on the day, you'll see the collections, so which are all the payments. And you'll see the scheduled value as well. So the schedule is going to be your potential for the day that is already on your schedule. So that would be a very nice number to look at, especially if you're looking to the future. So if you want to see how much is already scheduled for, let's say, next week, next month, you can tell which weeks are emptier than other weeks and which ones you need to maybe pump up a bit the appointments or add more appointments and schedule more appointments during that specific week. So it really helps you tell what is the potential production of the office in the future. So the next row is going to be production per procedure type. And again, this is something that you can fully customize from the admin side. So you can actually divide those groups depending on what type of procedures you're doing. So for example, the treatment can be divided into major restorations, basic restorations, let's say dentures, and others. So you can actually create different groups and you can track the production, you can set goals. So you can say, for example, I want 20% of my production to be coming from basic restorations. I want 40% to be coming from major restorations. So you can actually set goals for your production for both the treatment and for the hygiene, which is a really nice way to track how many perio maintenance is being done versus how many times a prophy is being done, and SRPs, for example. So you can actually track the production. You can say that I want more production to be coming out from my perio maintenance and SRPs versus, let's say, prophies. So you can actually customize this and you can track this again real time as numbers change on a basically patient by patient basis as the day goes by. Third level or third row of information, which is really important to track, is going to be your attendance and reappointment rate. So the first row that you see at the very top is telling you how many patients have attended versus how many actually were on the schedule. So 2 have missed their appointments versus 20 have actually attended their appointments. Then you can see how these 2 rows that you see, the TX and the hygiene, the treatment and hygiene, these are the reappointment rate. So this is how many patients actually scheduled their next appointment. So you can see out of 20 patients that attended, so those 20 patients here, 18 of them require a treatment appointment. So meaning that those are 18 patients that actually have a procedure that is coming up on their treatment plan, and 2 of them that are hashed out are patients that don't require any treatment in the future. 15 of them took a future appointment, and out of those 20 patients, 18 of them have a hygiene appointment for the future. So this is a very nice way to track the reappointment rate. And ideally, obviously, every single patient would be leaving the practice with 2 appointments, one for their treatment and one for their hygiene. So that way you can actually be able to track which patients have been scheduled, which patients have not been scheduled, and so on and so forth. So this is a really good indicator to track the reappointment rates on the dashboard. And fourth section that is on the dashboard is actually those pie charts that we saw in the exam. So new patient acceptance case, existing patient acceptance case, and the hygiene interval potential that will be available for you on the dashboard. And each one of those sections, whichever pie chart basically part that you click on, or if you click on any of the lists at the bottom, will automatically generate a list for you that you'll be able to track. So it will give you a patient list name, their age, their contact information, when was the last time they were in for a recall, when was the last time for their exam, when did you last communicate. So you can actually update this date manually, so you can tell. So if you have someone who's doing those calls to make sure that all the hygiene patients are on time, you can actually add a last communication date. So that way, every time you change it, it will automatically count the number of times you've actually contacted the patient. You can add a note. So you can say, contact the patient's out of town, would like to be contacted again. You can say yes, and you can add a follow-up date that will allow you to filter or sort by follow-up date. So that way, and let's say 2 weeks from now, you can go ahead and you can start following up with those patients. So every one of those, again, every one of those sections in the pie chart allows you to generate a patient list, and you'll be able to, again, review your notes. You can add a follow-up date, and you have a very quick shortcut to the schedule, their billing, the treatment, and as well, we've just recently added this, and it will be available soon on production on all your accounts, the communication. So you'll be actually able to send a text straight from this page without having to go to another page. So you can actually text the patient straight from here and tell them that, for example, they're late to their appointment, their hygiene, their cleaning, and you would like to schedule them for their upcoming appointment. So this is a very, very extensive and rigorous list that would really help track your hygiene better. And you'll be able, obviously, to print it out if you need to. And ideally, I mean, you don't need to print it out. You can actually open it up, and it obviously saves. So that way you're always adding your notes live into Oryx instead of it being on your, instead of it being on a paper and a pen and then basically having to find all those notes on your paper. It's definitely easier to add them in here. And soon we're actually adding a couple of extra things, like you'll be able to view all your historical notes on the patient. You'll be able to, again, jump to the communication activity from here. So there are a couple of upgrades that are coming to those lists soon as well. So a lot of the feedback that has come in, especially on our Facebook group, I think it's been amazing. We've been working really hard to update all the different enhancements and features that you've requested recently, and I think we have some really great features coming up very soon, and we're working full speed to make sure that we actually hopefully catch up with all those enhancement requests that have been coming in, and they've been really amazing feedback from our offices. Last thing I want to go over just very quickly for all our attendees that are not actually yet converted over. We do convert over data from over, I think, 15 to 20% actually softwares now. We've done conversions from all of those, and actually a few more by now as well. So we've done a lot of conversions. Those conversions can be done at any pace that you like. We can do them. We can do a quick conversion. We can do a slow conversion. We can go over different tests. We can go over it together. So we've been working really hard to create an easier conversion process for all our new offices. And as well, obviously, the native integration with our sensors are those 6 sensors for now as direct integration, and we do integrate with Twain drivers as well. So that's something that is worth considering. So we do integrate with Dexys, Gendex, Sopix, CareStream, and Jazz directly and natively. So it's really nice. You can actually just, again, you'll see it tomorrow in action with Nika, how you can import and acquire images straight into Oryx. And your data conversion will as well contain image conversion if you like, and you can actually add as well the document center. So anyone who's actually interested in doing a data conversion, now would be as well a great time to start with that, because you have right now time on your hands to do a slow conversion instead of it being during a very busy period where you have patients back to back. I think right now would be a great time to utilize the software fully, but with a slower pace practice, so that at least the entire team will be, I think, on a very good footing. Hopefully very soon we'll be over this really hard times, and hopefully everyone would be ready to use Oryx at its full potential, hopefully very soon. So that way, again, personally, I think our entire team would be available this period to support the entire list of users we have, and we have a lot of offices actually converting over, and they found this as an opportunity to actually do a conversion. So it's really worth keeping that in mind. And if you need any help with customizing your accounts, your realms, so that is definitely something that we can help with, because I think you have now the time to actually utilize this free time to maximize the potential of the software. And again, our support is always ready to help you. They can remote in, they can help you figure out what's the best way to set up your accounts, your software, so that way it will be running as smoothly as possible once you're back to full speed, and that way the software will be there for you to support you throughout that process. So I hope the training was actually beneficial for everyone. I hope it wasn't too much redundancy for people who have been using the software for a while. And tomorrow's training will be much more in depth, and it will actually be utilizing the actual software. Nika will be going through everything that I covered more in depth, and it will actually show you how to better utilize the software. So thank you all for attending, and it's been amazing show up. I think it's been really nice to have all of you as well interact on the chat and the Q&A section. So thank you all for being here and to actually been listening for me for 4 hours. So we'll see you tomorrow, and make sure that you sign up to actually show up tomorrow, because I think it would be even more beneficial for people that are actually interested in seeing how it's actually going to work live with patient examples. And Nika's going to be doing an amazing job with her, with the couple of flows and patient case scenarios that we have set up for you. So thank you all for attending again, and we'll see you tomorrow.